Morning, welcome to Harris Hall. This is the Tuesday, February 7th regular meeting of the Board of County Commissioners. Good morning, Mr. Mokrahayski. Good morning, Councillor Pettigrew.
Good morning.
This morning, Ms. Mokrahayski, we're out of order a little bit. We have a public hearing before the public comment. So we'll get started directly with a 9 a.m. Time certain public hearing, which is a public hearing and order 23020701 in the matter of referring to the voters of Lane County a renewal of the 5-year public safety local option levy. Sheriff Harold will be here with the staff today. And before I open the public hearing, I'll get to that in just a moment. Sheriff Harold, if you'd like to step forward with your staff. And Mr. Mokrahayski, I will introduce the sheriff as a separate elected official.
Good morning, Chair Farr and Commissioners. Thank you very much again for the opportunity to be here. I don't really have much in the way of comments. You've heard me speak already, and I think understand the importance of this. And so we're ready for the public hearing and then board action subsequent to that.
Very good. So there's no additional staff presentation prior to the public hearing?
Correct.
Then at this time, I will open the public hearing. Before I open the public hearing, please remember you'll have 3 minutes to speak. Keep an eye on the timer, which is to my left. It'll be directly in front of you as you speak at the dais. Once the hearing begins, I'll start by calling the name of the first speaker and letting the name of the next speaker on deck. If you're on deck, please be prepared to speak and to step up to the lectern and unmute yourself after the current speaker concludes their remarks. We do have people signed up both in Harris Hall and online. We'll conduct the in-person testimony first. It'll be followed by online, if any. So I'd like to open the public hearing on Order 23020701 in the matter of referring to the voters of Lane County a renewal of the 5-year public safety local option levy. We have 3 speakers in Harris Hall signed up to speak. The first person signed up to speak is James Walsh, who will be followed by Nick Crasper. Mr. Walsh, if you would step to the microphone, state your name for the purpose of the record, and keep an eye on that clock on the wall. There'll be no warning before the 3 minutes expires.
Good morning. I'm James Walsh, and I've been an attorney for 37 years, and I've been a member of the district attorney's office in the remote past. I regret that we're here today and we have to talk about funding the sheriff because it's such a core function of county government. And so I support the district attorney and the sheriff. I don't envy either one of them and their position because they're dependent on you and the voters for funding. But I think we have to pass this local option measure. I'm generally against local option tax measures. And I would challenge you as a board to find a solution to the sheriff's long-term funding problems so that we don't leave it up to chance and to a vote where we could suddenly have the sheriff closing wings of the jail, laying off employees, and affecting for the long term the sheriff's ability to recruit, hire, and retain talent within his department. So I urge you to find a long-term solution so we won't have to keep coming back and having these local option measures. Thank you.
Thank you, Mr. Walsh. Nick Crasper will be followed by Bill Humpton.
Good morning, Commissioners and guests. My name is Nick Crapser. I've been a resident and or an employee of Lane County for a number of years, in addition to currently serving on many boards in the county that are directly or indirectly affected by the jail levy. In addition to providing services for clients and residents of the Lane County Jail. I've also had the privilege of being a contractor with the Lane County Jail in the past and have seen firsthand the work that the folks do there with a very limited budget. My position is on the necessity of renewing the jail levy. There are several reasons, and I'll try to articulate them as much as possible. When a person is arrested, charged, and lodged in the jail only to be quickly released back to the community due to the lack of jail funding, it allows the arrested person to re-engage in the behavior that sent them to jail in the first place. More often than not, this involves some kind of a reignition or continuation of substance abuse, a heavier strain on their families due to continued abuse or neglect, and additional collateral damages to the public. Then what ends up happening is that a person has several active cases before they end up going to prison, often for a much longer period of time than they would have if they would have been adequately held accountable in the first place for the very first time that they got in trouble. And then there's much lower interventions available, including drug court, mental health court, court probation, or treatment instead of a lengthy prison sentence. Prison sentence. In addition, lack of funding for the jail sends a terrible message to others engaging in criminal behavior in the community. That message is that we cannot adequately address crime in our community protect our community, and we cannot help individuals with high criminogenic profiles by changing their lives and correcting their paths. Lastly, if we do not renew the jail levy, we're not supporting the work being done by our community partners, such as parole and probation, treatment providers, interventionists, and housing providers, just to name a few. Much of the work that our community partners do is predicated on matching the appropriate interventions with clients' needs. Sometimes the client's needs surpass what can be offered by these partner agencies and require the ability to house individuals and keep the individuals in jail for a short period of time. Given the work that I've done in the past to speak on the damage of mass incarceration and the dangers of using prisons as a first response rather than a last resort, I might appear to be an unlikely person to support this. The word that keeps coming to my mind is balance. While I do not have any empirical evidence to show you all today, what I can say anecdotally is that when you have a jail that is not adequately funded, you throw the system out of balance, a balance that must be made up somewhere else. In this case, by not having an adequately funded jail, the balance is made up by sending more people to prison. Folks that could have possibly been helped with a much lower level intervention, starting with being lodged in the jail, while the rest of the system, the courts, the DA's office, and public defenders, treatment providers, et cetera, have a chance to do their jobs. I urge you to renew the jail levy in the interest of the county, its citizens, and for the folks utilizing the jail needing that intervention the most. Thank you.
Thank you, Mr. Krautzer. Next is Bill Compton, and Mr. Compton is the last person signed up in Harris Hall.
Good morning, Commissioners. It's great to be here this morning. I so appreciate your service to Lane County. I, too, have been a servant of Lane County for over 21 years as a teacher at Willamette High School. In fact, I think I taught your children.
All three of them.
And so what a blessing it has been to serve Lane County. And so I'm thankful for you as well. I do ask you to think about something that a teacher always thinks about is the needs of the individual student. In fact, the program that I had started out small, but we had a program that was nationally recognized. Now, how did that happen? I focused on the individual needs of the student and the strengths of those students. I would ask you to consider Lane County Jail. It's a corrective institution, but it caters to, and I use that word deliberately because I visited and was in awe of the services that we provide for our local community. Those who have made poor choices are not isolated as what I would call the jailbirds. By the way, real quickly, I was shocked when I took the tour. My expectation of corrections was blown away. As I went in, I want to quote some things that I saw that was absolutely amazing. When I walked in, Clint, the gentleman who is the commander for the jail, gave me the tour, and the intake of adults in custody was appalling in a very good way. And I say that for this reason, is that they are individually interviewed to assess their individual needs. Do they have mental health needs? Do they have medical needs? Do they have family problems that have brought about their incarceration? They're individually interviewed, and then they are moved through the system to appropriately address their needs. Now, some are incarcerated for a long period of time. Some are worked through the mental health services they have inside the jail. I was appalled to find out that when they do the custody interview, it's not just about the individual, but about their family as well. For us to take this tool, this gem of what we have that other counties around the country have looked to as a model would be a travesty. Let me encourage you with a heart of compassion and concern for the individuals of Lane County that you would consider this amazing tool that we have, that not only would you encourage the continued support of that, but as was shared so eloquently, that we might consider how to support in a greater way our local law enforcement services of Lane County. Thank you very much for your time. I appreciate it.
Mr. Compton, thank you for so many things that I can't even talk about today.
Yes.
But thank you.
Have you here, Pat, I appreciate it.
I will say hello to everybody. Thank you. That concludes the list of those who have signed up in Harris Hall. Ms. Jones, do we have anyone signed up online?
Thank you, Chair Farr. At this time, we will be taking public comment for the public hearing on the sheriff's levy measure. If you have signed up for public comment for this item, please raise your virtual hand now, and I will call on you. Chair Farr, it looks like I have 3 hands up and potentially one more that I'll get to in a minute. I will start with Rose Wilde, followed by Laura Ray. Rose, I will unmute your microphone and you may begin your public comment.
Hi. Hi, thank you. I don't seem to have my video on, but hopefully you can hear me. So my name's Rose Wilde, and I'm a member of the Springfield Eugene chapter of Showing Up for Racial Justice, and also familiar with many of you through my service on the Lane County Budget Committee from 2008 to 2014, during the time when we initially passed the levy that funded the jail and some of youth services. So, you know, in the time since that, I have changed my position and now question the use of $22 million from the levy for the jail and just 9% for youth services. I think that Lane County could thrive with a lot more spending on mental health services, affordable housing, job training, substance use treatment, and more. And I have heard the arguments about the impact of not having sufficient jail beds. I understand that, but I also feel that in those arguments, it was primarily not based on data, but on fear of what might happen. So what I wondered, and a question that I had that I'd love to hear more about, is in the evaluation of the impact of this jail levy and of the capacity-based releases that happened before, what was the actual measurable impact on community safety? What was the actual impact on crime in our community? I would argue that the resources that the people of Lane County have to spend might be better spent in more upstream prevention and social support for folks. When I heard that much of the funds were used to staff services that provided for the mental and behavioral health needs of the people held in the Lane County Jail, I wondered why we couldn't spend that money sooner before there was any need for jailing. So I had a second question, which had to do with, I wanted to know how many people had died in our jail. I was aware of 2, Landon Payne and Jacqueline Cowens, in the last 5 years from some research from a colleague. And I wanted to know what other harms and deaths have occurred in our jail. So thank you very much for hearing my public comment today, and I wish you all a good day.
Thank you for your public comment. Our next speaker is Laura Ray, followed by Janet Morrison. Laura, I will unmute your microphone and you may begin your public comment.
Good morning, commissioners. My name is Laura Ray and I live in Eugene. I am also a volunteer member of Showing Up for Racial Justice. I have a few questions that I would like to ask first that I hope to see addressed today. What is the racial makeup of the people detained in the jail? Second question, what criteria is used to determine whether a person is brought to the jail rather than to a hospital or other facility? And third, why has the percentage of the levy funds devoted to critical use services rather than the jail dropped from 21% of the total levy funds in 2016 to 17 down to just 9% in 2020 to 21? How has this drop impacted the Phoenix Treatment Program for youth? So those are my questions, and now I'd like to make a statement. I support a vision for what our community could look like without putting millions of dollars annually toward the county jail and youth detention. Instead, all in Lane County could thrive with increased funding for mental health services, affordable housing, job training, substance use treatment, education, and more. I want to note the 2020 hunger strike by those detained in the jail, which highlighted the poor living conditions there, including inadequate COVID precautions, as well as moldy food, a lack of diversity training, worn out beds, commissary price gouging, and the lack of an emergency alert system. And this is a quote from Kevin Eggleston, a person detained in the jail who was part of that hunger strike. We clean the hallways, we feed people, we cook in the kitchen, and we give out the clothes for nothing. You pay us nothing except for an extra tray. You treat us like dogs. I also want to note an Eugene Weekly article from September 2019 regarding conditions in the jail. This is a quote from the article. Because Oregon State Hospital is often full, defendants can deteriorate in jail, waiting for a bed at the hospital. Inmates are sometimes locked in medical segregation cells because their mental illness makes them a danger to themselves or others. In 20 of the 34 cases we examined, defendants were left in jail beyond the 7-day limit. I'd like to see public funds put towards mental health services and other supports that are so desperately needed in our community, not toward jail beds. And I'd like to say the names of the people who have died in the Lane County Jail in recent years. Landon Payne, who died in March 2020, and Jacqueline Cowens, who died in February 2018. And again, I would like to know if there are names of others who have died in the jail recently. Thank you.
Thank you for your public comment. Our next speaker is Janet Morrison. Janet, I will unmute your microphone and you may begin your public comment.
Thank you and good morning. My name is Janet Morrison and I welcome the opportunity to be able to speak to you. I was able to hear the Sheriff Department presentation in January, thanks to Zoom, regarding the repeat jail levy proposal. And I thank the department and you for your efforts to serve the community. However, I urge you as county leaders to question what has long been termed safety in our county and our country. In Sheriff Harold's January 25th memo to the board, he told us that the public levy allows vital services to continue. Without it, Lane County would be a less safe place and people in need of medical or behavioral health interventions would go without. Although I'm relieved that folks being detained in the jail are provided some mental or health care interventions, according to Lane County Sheriff Office, as many as half of the people in the Lane County Jail at any given time have mental health and or co-occurring substance use disorders. We must address the needs instead of jailing people who are ill. As a community, as a human being, and you, please let us address and serve these needs instead of providing more jail beds. In closing, I respectfully ask the board to investigate communities where trauma-informed care funding has surpassed jail bed funding and the decreased rates of recidivism and a more healthy outcome for all is the result. Thank you.
Thank you for your public comment. Excuse me. I do have one additional speaker, but you have come in on a phone line, so I only see your phone number, and I believe you are unable to raise your hand as such. Your phone number ends in 19, and I'm going to unmute your microphone, and if you would like to speak, please begin your public comment now. If we don't hear from you, I will assume you're not calling in to speak on this item. And your phone is muted if you're planning on speaking, so you would need to unmute. There you go.
Okay, thank you. My name is Derek Wing. I operate Mather's Market just outside of Springfield, just east in the Cedar Flat area. I could only call in. I'm actually in Florida right now on family vacation, but I wanted to call and express my support for this public safety levy. I know we've all seen things change in our area, not always for the better. I think taking money away from the jail would be taking away vital resources that the cops very much rely on to keep people out of the community who shouldn't be in the community. I do understand we have a lot of mix of mental health and drug abuse issues as well. But in some regards, we just need to have a place to get people out of the community for a time to assess what should be done with them next. I'm raising a family in this area. I know there are areas I can't go in Eugene, Springfield, where we don't go with the kids because it's dangerous. It's not to say it's anyone's particular fault, but I think right now, if we choose to take away a huge tool for the deputies, I think we're only doing ourselves a disservice. And that's all I really have to say. Nothing too complicated, but I know myself and a lot of young families, this is a very big issue. And we rely on that safety from having sheriff deputies in the area to basically live happy, productive lives. So if we don't have that, it's quite more tricky. So thank you for your time, and you guys have a great day.
Thank you for your public comment. Chair Farr, at this time, we have no additional people signed up to speak, so I will return the meeting to you.
Thank you, Ms. Jones, for handling the online queue. I'll ask at this point, anybody else in Harris Hall wish to address the Board of County Commissioners on the public hearing on the jail levy? I see no one. At this point, I will close the public hearing. And Sheriff Harold, I'll turn the floor over to you for any staff presentation you wish to present. And I note you do have some VIPs in the audience.
I do. As I've expressed to the board before, I like to bring really smart people that I get to work with to these sorts of things with me in case there are questions that I need help answering. So I'm super fortunate to have such a great team. And of course, we have Star Felty here also for any questions related to youth services. I would point out, we heard some great public testimony, and honestly, I heard much agreement in every single speaker's presentation. Folks who have concerns about incarceration versus mental illness, and I think the board knows from hearing me speak, I don't know that there's been a louder voice than the sheriff's office to say that we need a better system for those that are struggling with mental health. You all have heard me on numerous occasions say that I wish there was a place other than the Lane County Jail for folks who are struggling in their mental health crisis. They're engaged in behavior in the community that alarms folks or disrupts people's business. And so the community members call law enforcement because they want a solution. This individual's behavior is disrupting my life. Please solve this problem. And we don't have a great solution, and they do end up being arrested for, generally speaking, a misdemeanor crime and brought to jail. And so you all have heard me speak to that on numerous occasions. The state government continues to wrestle with it. The legislature continues to wrestle with it. It seems like an easy out for me to say, the state really has to solve that problem. But the reality is the state's got to solve that problem. We are working hard at a local level, and you all have heard lots of presentations on a crisis stabilization center. So we are working hard at a local level to do what we can locally. And the sheriff's office has been part of that very integral team for years now, leading the charge. And we will continue to be, because as I said, I find much agreement with every speaker who spoke today. I would also encourage, and I think the board has heard me speak to this before, I would encourage us to take a look at the Lane County Jail as an upstream intervention, as Mr. Crapser spoke. And some of you may not be familiar with Mr. Crapser, but take a look at his history. He recognizes the work that is being done there that is upstream work. And I think, too, we could go in more in-depth analysis, but if we took a look at the way Lane County was operating from 08 to 12 and the impact that had on the way we sent people to prison versus being able to do an early intervention and not end up with somebody who was able to proceed so far down the path of criminality that they end up with decades-long prison sentences because we were able to interrupt it earlier. So I feel like I'm repeating some of my initial presentation, and I'll stop myself there, but would be happy to answer any questions that the board has before they proceed. And also if Star has anything she wanted to mention with respect to youth services. I said I was going to stop. I'm going to stop.
Good morning, Ms. Felty.
I'd just like to say that, to answer some of the questions that were initially asked, youth services has significantly benefited from the levy and the youth we serve in the Phoenix program and in detention. We work our best to do the early intervention with the criminogenic youth, and part of that is Phoenix as a BRS intervention. But we do have youth that come into detention who have not received prior service. And we absolutely provide services. We have mental health services as well. We're looking to expand and to provide additional services, including substance abuse services within our structure, and renewal of the levy would be critical for that to happen.
Thank you, Ms. Felty. Ms. Mokraski, anything you'd like to add prior to turning it over to the board for questions and comments?
I think we'll take questions. Thank you.
Very good. Thank you, Ms. Mokraski. Then I'll look for a cue this morning, starting with Vice Chair Trieger.
Thank you, Chair. Good morning, everyone. Thank you for coming. Good morning, Sheriff, Ms. Felty. Appreciate you being here. I really, everything, what they just said is what I would say. I appreciate all of the public comment, and the response from Ms. Felty and the Sheriff are some of what I would say. I want to elevate a couple of things. One is, again, a call out that we are working really hard to open our Behavioral Health Stabilization Center, which will not necessarily reduce the need for the number of beds in the jail, but it will serve the people that need the kind of treatment and attention in a different way. We are at such a minimal operation in our jail that this is really barely just keeping our head above water. This is not an expansion. This is not an overreach. And I think it's important, for me, it's important to also state that our jail is also a work site here at the county. And so everything and anything that we can do as commissioners to encourage the public to understand that we have to create conditions and a workload that's tenable for our staff who are tasked with some of the most challenging day in, day out work, right? There are folks housed in our jail who may be there for a few days or a few weeks or in a few occasions, a few months, but we have employees who've been there for years and years and years, and they're there day in, day out. And so it's really important to do what we can, and that means adequate resources to provide the services that the public deserves, but that our workers need us to support them in so they can do their jobs. I will also say I really appreciate Mr. Krapser, and it's good to see you again, for talking about systems, because the jail is a part of a system. And so anytime, it's like a Jenga game, right? If we pull the wrong blocks out or too many of them, the whole system's collapsing. So we are working hard to fill in gaps, add services, do better, upstream, midstream, downstream, and the jail is just one piece of that. And what I want to say to everyone who commented about redirecting the resources, there simply aren't enough resources is the problem. It really shouldn't be a zero-sum game. So our job is to put before the voters the opportunity to invest in better services for Lane County. We had tremendous success doing that with our parks levy last fall, and I have every confidence we can do that with a public safety levy this spring, because our job is to put this option to the voters and then communicate with the voters about how this benefits everyone from a systems perspective. It's not a zero-sum game. We can't play, we don't want to pit departments or efforts at the county against one another. No one wins when we do that. We don't need to say one service is more important than another. They're all important. That's why we provide them, because it's what the public needs, and we're here to do that. I will also add that the jail is a healthcare setting, and I know constituents really care about making sure people have access to the healthcare that they need, and that is where some people get, sometimes for the first time, or the first time in many years, healthcare, as well as mental health services and an opportunity to connect to substance use disorder treatment. So really important services provided there. I think we would all rather there was less need, and that the need that there is was less severe and less complex, and we're working on it. But in the meantime, we've got to keep this critical piece of the system going. So our job, my job, and I've said this to the sheriff privately, but I will say it here in public, is to communicate with my constituents about why this matters to them and how this improves community conditions for everyone. And it's not about competing. If we want to talk about having adequate resources to fund public services, that is a larger conversation that also involves voters, because voters have been a part of hamstringing all kinds of public entities in delivering the services that the public then says they want. So thank you for being here again. You have my full support.
Thank you, Vice Chair Trieger. Anyone else in the queue? Commissioner Laval.
Yeah, I echo all the comments that Vice Chair has mentioned on the sheriff's staff. You guys are always superheroes in my book. Being at the Well Path presentation while Sheriff Harold was on vacation, they put out a number of good points and good data that the sheriff's office is continually morphing into the best thing that it can be. And like Vice Chair said, it is a healthcare setting. And what I think struck me the most about that presentation was the lamented comment that the jail psychiatric doctor said, is that we're now criminalizing mental health when we shouldn't be, because the jail is the only place in Lane County we have to take them. And the jail recognizes the fact that this is the only place they can go, and they have over and above their job calling made this, as Vice Chair said, a healthcare setting to get the people who come in there right, get the medication, get them assessed, and get them down to the path where they could go somewhere differently than where they're headed now. And they do it with such compassion. I was moved beyond in that room talking to people after that meeting of how they took their job so compassionately and seriously when they looked at people that were, we say inmates or criminals or whatever the word you want to throw. These people that work in our Lane County Jail see these people as genuine souls for the community, and they treat them with such respect. I was super impressed. And I can't thank you, Sheriff, enough for leading the team, and Star, for you leading the youth facilities to do this job. That's the most difficult job we've just pressed upon them without the resources to do that they do day in and day out. And what I talked to again was we need our own mental health hospital in Lane County. And my idea was, why can't we make the jail hybrid mental health with whatever resources we could throw at it? And, you know, there's some out of the box thinking that could be done, but I think the county and the commissioners before us and the commissioners now are doing everything we can to make sure that we're not overburdening our sheriff's department and our jail department to do a job that's thankless and that we've asked them to do, that we as the community members need to put that in a different light so they can do the job of sheriffing and getting bad guys off the street, and that we can do the job of healing people that need healing. So Sheriff, you and your staff, my hats are off to you. You guys are the most compassionate people I think the county has at its disposal and its arsenal, and I'm proud to serve with you, and I support you 100%.
Thank you, Commissioner. Further in the queue, Commissioner Buck.
Thank you, Chair. I think people have already said a majority of the stuff that I was thinking while we were having comment. The idea that ideally we would have acknowledged mental health first and built out mental health services prior to the ultimate end game of having to go to the jail would have been nice, but that is unfortunately not the way our society responded initially. And we know better now. We have more information than we ever have had before. We know what services need to be built out. And it's not one service against another, as was said. It's all of the above, absolutely all of the above. And we're working very hard at doing what we can as a county to ensure those services are built out, but it's more than us. We can't do it all. And as much as we strive to find funding in any way, shape, or form, and as the Board of Health for Lane County, we still need assistance from the state and federal government in order to build out those systems. It is, you know, this is a national issue, and we are on the leading edge of many of these additional services here in Lane County, and I'm very proud of that. And I understand in some speakers that there is some criticism, and that's what makes us better. We will respond and acknowledge that criticism and improve as we go along. And I ask for their support and assistance in order to build out all of the services that we know we need. In the meantime, it is absolutely critical in order to pass this levy. It is basically a baseline of public safety in the county. And we can't not have that basic service. It will behoove us as commissioners to go out and continue to talk about the levy in every one of our districts, with the assistance, of course, of the sheriff and their team that's working on this particular levy. I just want to make sure that the public knows it's not one or the other. It is all of the above, and we welcome your assistance to get there. Thank you, Chair.
Thank you, Commissioner. Commissioner Seneca, thank you.
Yeah. I mean, all these comments speak for themselves. We are very proud of our sheriff's department here. I think, you know, you have my full support. Evidence of that is the multiple meetings we have set up to speak through in my district. Our rural districts are really, this means a lot to them. Most of aren't in for another levy, but they understand that this really is, as Vice Chair Trieger said, just to keep our head above water. We are looking for long-term solutions, and it's something we're talking about. But this is something that needs to happen. It needs to happen now. I wish more people could have seen that WellPath presentation that was put on. And Riley, you were doing an amazing job of thinking outside the box. One of the statements that was said during that meant a lot was, this is the biggest mental health hospital in the county. I mean, it's our jail, but you guys are doing what needs to be done to take care of these people, and the passion that's going into the detox and to addressing mental health issues. And I mean, just the cost of medications was astounding. And these are things that the sheriff has done a great job letting us know, but as commissioners, we need to keep reiterating this and hitting on that drum. So you have my full support.
Thank you, Commissioner Seneca. Sheriff Farrell, Ms. Felty, thanks for being here this morning. You know, on the way in this morning, I had an opportunity to talk to Captain Riley for quite a bit. And we talked about the critical, something that we're all talking more and more about, and that is the intersection of criminal justice and behavioral health. And where else is it more evident than at the jail, where we have so many people who are brought to you by the different jurisdictions, brought to you. You didn't ask, you don't invite people. People are brought to your door. You bring them in, and the first thing, as Mr. Compton said, the first thing is an interview to determine what level of service they need and where in the jail to receive that appropriate level of service. The services that are funded by the jail levy, by the way, that the medical services, the behavioral health services. You know, Captain Riley has become quite a superstar. We have a video on the upstream version of the critical intersection of behavioral health and criminal justice, and that's before the criminal justice system is involved. And we had a speaker today talk about why don't we get upstream. Well, our forensic intensive treatment team, our FIT team, goes out into the field, identifying people with behavioral health disorders who are homeless, who otherwise may not enter the system or come into contact with the system other than through the criminal justice system, through a response by first responders, getting to them ahead of time and trying to place them in the correct level of services. Now, we are at a dearth in Lane County. We don't have sufficient services. We're working on that. As Vice Chair Trieger said, we are working on a stabilization center, and soon, in the grand scheme of things, the word soon works. Soon that'll be online, and that'll give an option for first responders to take someone instead of bringing them to the jail. But in the meantime, they come to the jail, and as Mr. Compton said, you interview them, and they move into the correct level of service. It's pretty impressive. Vice Chair Trieger, I always love going after Vice Chair Trieger because Vice Chair Trieger always talks about things that I think I wouldn't have said that if not for Vice Chair Trieger bringing it to my attention. And what you said was that one of our jobs is to communicate with the people in Lane County, with our constituents, what the services that we're providing. And there are no services that we have that have more questions in the community than the jail services. And Vice Chair Trieger and I one day toured the jail together. And it's that tour of the jail that really communicates the effective measures that are being taken inside of the jail that are different to other jails. And Mr. Krapser, you mentioned jail services come before prison services, that adequate services inside the jail, particularly those that prevent recidivism, and our jail is designed to prevent recidivism, prevent people from going up the street to the prison system, which is a far more intense, far less accommodating system than the county jail. So we're, you know, I'd like to say that we're, based on my tours of the jail and the continual improvement that I see there, you're doing the best that you can, the best that's possibly can be done regarding making certain that people don't come back in, that they get the services that they need. And that it doesn't help us to lose track of the fact that at the critical intersection of criminal justice and behavioral health, there's a lot of work to be done. But there's a great deal of attention being focused on it. I'll mention one more thing. Each month, Sheriff Harold and Captain Riley and Chief Deputy Wilkerson and Ms. Felty, you're involved in the Mental Health Summit. Here in Lane County, monthly, we hold a Mental Health Summit with a lot of people who have a lot of insights regarding how we can address critical issues at the intersection of behavioral health and criminal justice. And we're going a long way. Next Monday, I'll be at the National Mental Health Summit, and we've been asked to spotlight Lane County at the National Mental Health Summit on the upstream services keeping people out of jail at the intersection of behavioral health and criminal justice. And he didn't know it, but Captain Riley will be a star of that show too. We'll be using the video that's been provided regarding our FIT team that once again provides the services in the places where the people are living. A lot more to be said, but I'll turn it back to you, unless Commissioners, anything else? Sheriff Harold, anything else?
No, I don't have anything further, Chair Farr.
Ms. Felty?
Thank you.
Thanks very much. Then we have before us Order 23020701, Vice Chair Trieger.
Chair, I'll make a motion that we approve Order 23-02-07-01 in the matter of referring to the voters of Lane County, a renewal of the 5-year public safety local option levy.
Moved by Vice Chair Trieger and seconded by Commissioner Buck. Order 23-02-07-01. Discussion to the motion. I'm seeing no discussion to the motion, then I will call for the vote. All those in favor, please say aye.
Aye.
Passes unanimously. Thank you for the presentation this morning. We have one more item of business to cover, and that is Order 23-02-07-02 in the matter of appointing a committee of 5 residents to draft an impartial, simple, and understandable explanatory statement for the May 16, 2023 voters pamphlet regarding the question of renewing the 5-year public safety funding levy. And Sheriff Harold, you have the floor once again.
Chair Farr, I also would look to Devin Ashbridge, who has been of tremendous assistance to me. She's worked through one of these once before with the Parks Levy, and so if the board has any questions, I would lean on her understanding of the process, but I think we do have some great plans for the process, and so just needing the board to take that next step.
We do. So Chair Farr, Commissioners, Lane Code requires that if Lane County wishes to place a statement in either the state or a county voters pamphlet, that the board create an explanatory statement committee made up of between 3 and 5 Lane County residents. That group will then be charged with writing a neutral and detailed statement on the proposed levy, its cost, and its anticipated effects of not more than 500 words. The committee will then work with staff to submit that directly to the elections office for inclusion in the pamphlet. And so the board role in this process is to establish the committee. And I very much appreciate that each of you recommended one of the members before you for consideration today. And then staff will provide support for the committee and ensure they're able to complete their work by the March 16th deadline.
Thank you very much, Ms. Ashbridge. Questions or comments for the Sheriff or Ms. Ashbridge? I see none. I'll just take a moment to say the members of the committee that will be voting on the committees which are on Order 23-02-07-02 are Steve Carnacchia, Julie Gibson, Jeff Gowing, Chris Pryor, and Paul Solomon. All names we know. So I'm looking forward to seeing the work of that committee. Then Vice Chair Trieger, you have a motion.
I do, Chair. I'll move approval of Order 23-02-07-02 in the matter of appointing a committee of 5 residents to draft an impartial, simple, and understandable explanatory statement for the May 16, 2023 voters pamphlet regarding the question of renewing the 5-year public safety funding levy.
I'll second that. Moved by Commissioner Trieger, Vice Chair Trieger, and seconded by Commissioner Lovell. A discussion to the motion. Seeing none, we'll be voting on Order 23-02-07-02. All those in favor, please say aye.
Aye.
Passes unanimously. Thank you very much. You had 45 minutes and you came in at 44. Good job.
Thank you, Chair and Commissioners. Appreciate it.
Thank you. Sheriff Harold is always spot on time, I'll tell you what. But, Mr. Mokarisi, in order to get to the 9 o'clock time certain, I passed by items 1 and 2 on the agenda, which is any adjustments to today's agenda.
I'm not aware of any.
To the board, any adjustments? I see none. And any emergency business for today's agenda?
No.
To the board, I see none. Then we'll move directly into public comments. We'll ask for public comments from people in Harris Hall first. You will have 3 minutes to make your statement. Public comments regarding anything you wish to talk to the Board of County Commissioners about. When I call your name, please step to the microphone. You'll have 3 minutes. Keep an eye on the clock. It's to my left. It'll be directly in front of you. There will be an audible bell sound when there is 30 seconds remaining in your testimony. At 3 minutes, I will ask you to leave the microphone and turn it over to the next person. Then the first person signed up for public testimony today in Harris Hall is David Eigel, who will be followed by Paul Metzler.
I'm David Eigel. I've numerous times brought to you the basic issue of the fraudulent history that's being presented in the Racing to Change program at the Lane County History Museum. The reason I'm approaching the commissioners is several-fold. First, of course, since you fund this organization, you're the primary, not exclusive, but primary source of funding. You're involved in this manner, of course. Also, you have a need to be involved because of administrative oversight. In addition to the misinformation that's being put out, there's been, I believe, serious misconduct in terms of the administration of the program, and that in my case, when I brought information to the organization, it was excluded. Then when I became a member and showed up, I was unlawfully removed from the meeting last year on Zoom, the annual meeting. And to make matters worse, the film, which is on YouTube, of the meeting was edited so that this was cut out. Very, Stalinist-like keeping of history. What can you do about this? Well, obviously you can get involved. But one of the things, in addition to dealing with the problems at the museum itself, is when you have a wonderful person like Frederick Dunn, who's just the opposite of what he was portrayed as, this kind, Dave Frohmeyer-like man, lifetime love and service from one of the most heroic abolitionist families in America. Here's something, we're talking about funding. Here's something where you can do something that wouldn't cost you a penny. You could deal with this matter simply by declaring a Frederick Dunn Appreciation Day and letting publicity come out. This would attract attention. People would then learn the actual history, and that would save all that money for the jail and the medical help that people need. So that's where I stand. I'll be contacting each of you individually. The annual meeting's this Saturday afternoon. I've got a guest slot available. If any of you want to be my guest, I'll be happy to take you. Thank you so much for your time and attention.
Thank you, Mr. Eigel. Paul Metzler is the last person signed up in Harris Hall.
Good morning, Commissioners, and thank you for this opportunity to speak. I'm Paul Metzler with the Lane County Republican Election Integrity Committee. Like so many millions of Americans, we were shocked at what we saw during the 2020 election. And since then, we've witnessed a collapse of confidence in our nation's election process. Our whole country has been told, follow the science. So we undertook to research the state of voter registration here in Lane County. We looked at the voter roll and found that there are more registered voters than there are adult residents of Lane County based on the July 2021 voter roll and the U.S. Census data. We saw that there are ludicrously high numbers of voter registrations at fake addresses. We then went to 64 locations that have 8 or more registered voters at one resident's address. We then presented a clipboard to whoever came to the door with a list of registered voters at that address. We just asked the person who came to the door to check yes or no to 2 simple questions. Is this the person's residence address? And if no, do they intend to return? That is the criteria for voter registration, according to the Secretary of State. We inquired of 705 voters. Of those 705 voters, 57% do not live there. This includes active and inactive voters. It's worth noting that inactive voters can update their status and they can vote a ballot up until 8 p.m. on election day. In November 2020, approximately 4,000 voters in Lane County updated and voted on Election Day. And on the November 2022 election, 4,054 did so. No ID is required to do that. These anomalies undermine confidence, they undermine democracy, and effectively discourage voting. After all, why bother to vote when the county's being inundated with illegitimate ballots? That is the message that's being sent to the public. We ask that the commission instruct the county clerk to clean up the voter roll. Thank you very much for your time.
Thank you, Mr. Metzler. I've been informed that there is no one online signed up to speak. Is that still the case, Ms. Jones?
That is correct, Chair Farr.
I'll look around Harris Hall and invite anyone else in Harris Hall to present testimony to the Board of County Commissioners. I see nobody. Then I'll close public comment and look to the Board of County Commissioners for response and/or remonstrances. Commissioner Buck.
I just wanted to share that both Chair Farr and myself will be attending the National Association of Counties legislative session. And that's why, we usually have a down week, the week of NACO's legislative session, so that we can attend. It will be in DC, and I look forward to going. It's set up a little bit differently than the Association of Counties. And I, encourage our new commissioners next year when we have another one, it's annual, that you consider attending. It's a lot of fun, and we learn a lot of information about what's going on in counties across the nation. In addition to that, I have just started working on going to some of the meetings on the new committees that I've been assigned to. And we haven't really had a chance on our board to share what's going on in each individual committees. I thought I'd just put that in your ear to see if we might be able to incorporate that in the future, because we can't be at every committee all the time, and I'm interested in knowing, and I don't always have all the notes from the other committees that are going on. And I'm really interested in how you're thinking about the new committees, how they're going, and what they're working on. So we can think about that perhaps in the future. Thank you, Chair.
Thank you, Commissioner Buck. Further remonstrances? Vice Chair Trieger.
Thank you, Chair. I'd like to, that's an excellent idea, Commissioner Buck. Would you like that for the agenda team to look at a time to make that an item at a meeting where we all just give a report back and we have a little notice so we can prepare remarks?
I think that would be great if that's something we all concur to.
Great. And maybe we do that a few months out so we have a chance. Some of the committees only meet quarterly to get into the rotation to attend. Okay. Great, noted, thank you. I prepared comments because I have several items I want to speak to today. First, I just want to give a shout out to our TS department. They did an internal survey. I know I've used the help desk a lot, learning my way around the tech side of this organization. And it's very internal and sort of invisible work, so I wanted to daylight it here in a public meeting for everyone. They really do excellent work, our TS folks. It's complex, it touches every single part of everything the county does, and really appreciate their commitment to continued process improvement and for sharing those survey results with us. I want to wish everyone a happy Black History Month. And there's still a little month, over a month left to visit the excellent Racing to Change exhibit at the Lane County Historical Museum to learn more about the unique history of Black people here locally. Of course, we can celebrate Black history and Black contributions all year long because Black history is everyone's history. On a more somber and distressing note, a few days ago, I learned that an extremist national hate group with local ties has been distributing dozens of flyers with anti-Semitic messaging to numerous households in the Thurston area in Springfield. This group's messaging and tactics are well known to target not only Jewish people, but typically also include imagery and messaging that perpetuates harmful racial and anti-immigrant sentiments, and that target the LGBTQIA+ community as well. Actions like these cause real harm, both to the people who are directly targeted and to the wider community, and should be unequivocally denounced. The good news is that some neighbors in Thurston who received these vile flyers not only did the right thing by reporting it to the city of Springfield, to officials there who I understand are responding with appropriate seriousness and urgency, but several of these neighbors also took it upon themselves to then create a series of their own flyers with positive anti-hate messages, which they distributed throughout their community to counter the offensive, dangerous acts. Hate and bias incidents and crimes are on the rise, particularly those being perpetuated against Black and Jewish people. The Oregon Department of Justice established and staffed a hate crimes hotline starting in 2020, and it's dedicated to assisting victims, witnesses, and other reporters of bias crimes and bias incidents. Their report shows that in 2021, an average of 140 calls per month came into the hotline, and that number rose to 228 calls a month last year. These represent calls only that come into this state hotline and do not represent the total number of these kinds of events in our state by any stretch. This is a particularly dangerous time to be Jewish in the United States. As angry and saddened and frightened as this has me, the response of our community gives me hope that there are so many people here in our own backyard who are ready to stand in solidarity and say not in our town to this kind of harmful and vile act. Their actions matter, and I offer them my deepest gratitude. And finally, I want to share that this past Friday, I attended treatment court graduation right here in this room. About a little program. 5 people shared their personal stories, including one who had been living under the Washington Jefferson Street Bridge in the encampment there. And he said he had all but given up on himself and was consumed with simply trying not to die. But street outreach workers didn't give up on him, and he eventually was able to accept help and get clean and sober. And he is now housed and employed and healthy. And it was truly an inspiring way to wrap up the week last week. It was life-affirming, that ceremony, that graduation ceremony. It's a wonderful reminder of what people can do when they're given the support and the tools and the time that they need. Thank you, Chair.
Thank you, Vice Chair Trieger. Commissioner Lovell.
Thank you, Chair. In that vein, I also too have a prepared statement concerning our mental health system that's going on. I recently read an article about something going on in California that struck me and moved me to ask and have you listen to these words. 59-year-old James Mark Rippey died 2 weeks ago. He was the most famous homeless person in Vacaville, California. For 16 years, he lived on the streets due to schizophrenia, and yet constantly by his side were his 2 sisters advocating for their baby brother daily. Yet he repeatedly turned away help. After all, it was his individual right. But the real death here is the fight between civil libertarians and families who squabble over what is fair and right and humane and necessary when trying to intervene in the life of someone with incapacitating reason. One who is incapable of choosing soundly a life decision over the indecision of slow and certain death. So I ask here in this public forum, when did families lose the right to protect their own loved ones? And when did we as a community disallow an important means of help and survival in exchange for a policy that does neither? We need a few things. First, care courts, community assistance, recovery, empowerment courts that would help bridge the gap and red tape of humane advocacy. These would help involuntarily and temporarily direct those most vulnerable who can't grasp the razor's edge of incapacity they unknowingly find themselves, back to a place that could be life-altering and definitely life-saving. This gives loved ones a sound lifeline to their suffering family members, like this program they have now in California. Second, our task force of compassionate and on task, the FIT team needs to be expanded. We need a higher presence of directed people whose job it is to find and connect those mentally challenged on our streets and to physically take them by the hand, leading them to a place of hope instead of a pamphlet with simply phone numbers attached to it. Programs that I've seen now I know work are the models of Everyone's Village and the Deschutes County model, which we were directly experienced with our own son. Families want to save their loved ones. Families don't want to live with the frustration, shame, and certain sorrow the legal system binds their hands with. Humanity needs a tool of which we can still be humane. Care courts and intentional relationship intervention, I believe, could be these answers. We must give families the means to help those who can't make the choice to live with an outside choice made for them to live. I understand the autonomy and freedom. I mean, hell, I spent 6 years in the Navy defending your freedom to every right with military service, but I simply don't understand why we don't make a way for the sound-minded loved ones the right to make living decisions to trump those defaults of death. The right to get treatment for a disease that is no way the fault of the sufferer, nor the fault of families only wishing some lane of advocacy bound at every turn by bureaucratic excuses, which ultimately are left to the pain to write an obituary. How many times and how many Mark Rippies are we going to let die on our streets? How many William Bianzica Lovalls are we going to wait to harm themselves or harm others before we step in? It is because we're maybe too afraid to infringe temporarily on the rights to keep them alive. Let me repeat that. Maybe we're too afraid to step in to maybe make their rights aside to keep them alive. But I believe it's time we start reconsidering what is right and what is wrong and what gives life and what could save it. Thank you, Chair.
Thank you, Commissioner Lovall. Commissioner Seneca. I thought, sorry, I had a presumption that I should not have assumed. Thank you very much. Then a couple of things I'll mention. Commissioner Buck, I'll respond to you regarding the committees we serve on. We all serve on committees, and quite often that service goes unheralded or unreported. I serve on the Mental Health Advisory Committee, which is also our local drug and alcohol policy advisory board. And we meet once a month. And starting this coming month, the chair and I, after the meeting, we're going to put together a tiny little report, just a 2-sentence or 3 or 4-sentence report on what happened in that meeting. The Mental Health Advisory Committee is a statutory committee. We're required to have it, but it also is populated by people who, it's what they do for a living, and their advice is valuable. So it'll be coming at every Tuesday board meeting. During this time, I'll take a minute or two just to talk about what happened in Mental Health Advisory. That's one means we can do it, but when it comes time to actually put in this as an agenda team request, I'll be in support of that. Because what we do in those committees, it's not quite like the legislature where all of the work happens in the committees, but a lot of work does happen in the committees, and they are advisory, and they are very valuable committees, and citizens take their time to work with us on policy recommendations. So, good idea. You mentioned the NACO, National Association of Counties Legislative Conference, that's happening this week, and I believe Mr. Mark Heisky is going to be traveling to that also. And coincidentally, not coincidentally, I'll be spending a little bit of time with a good friend of mine who used to work at the University of Oregon. I served in the in Alpha Company of the 162nd Infantry Battalion here in town with him. And I'll be spending time with he and his wife, who we introduced to each other 37 years ago. But one place we will be visiting is the National Museum of African American History. That we actually have a reservation. You have to put a reservation in. It's not hard to get a reservation generally, but we have a time that we're going to be going to visit that museum. It'll be our first time at that museum. I'm going to say a little bit about Colonel O'Connor, Tony O'Connor. He was my commander in Alpha Company, a rifle company, and I was a platoon leader at the time. Our executive officer, there were only 3 commissioned officers in that company. It was Captain O'Connor, Second Lieutenant Farr, and First Lieutenant Tom Egan, a name very familiar to most of us in this room, Tom Egan. So whenever Tony and I talk, Tom and Tony were very close friends, had served in the military for a long time together. Tom was Tom was Cav, armored Cav, and Tony was armor. So they talked in a language I didn't quite understand. But when Tony and I get together, I always come back with new stories about Tom Egan. So be prepared for that. A few other things to talk about, but we've gone overboard a little bit. Any further comments from the board? Seeing none, thank you very much. We'll move down the agenda to our consent calendar. We have before us a consent calendar. Each item on this consent calendar has been considered by the board, and if you'd like to take a look at it, click on View Items online. You can see all of the material that the board has considered before allowing this to remain on the consent calendar. If anything had needed separate discussion for any particular reason, it would have been pulled from the consent calendar by a board member, which did actually happen with one of the items which will be considered separate from this consent calendar today. So we have before us a consent calendar. Do I have a motion? Vice Chair Trieger.
Chair, I move approval of the consent calendar for Tuesday, February 7th, 2023.
Moved by Vice Chair Trieger and seconded by Commissioner Buck. Discussion to the motion. I'm seeing none. All those in favor, please say aye.
Aye.
Aye. Passes unanimously. The next item on our agenda then will move directly into item 7A, which is Health and Human Services, Order 23020710 in the matter of extending a sole source determination of St. Vincent de Paul for navigation services at safe sleep sites and delegating authority to the county administrator to execute a contract amendment for these services. Commissioner Buck.
Thank you, Chair. I am going to declare a conflict of interest on this particular item, as this is a transaction involving St. Vincent de Paul, and I am related to the executive director of St. Vincent de Paul. I'll step out in the hallway, and when you're done, maybe somebody can call me back. Thank you.
Thank you for that declaration, Commissioner. In Commissioner Buck's recusal, we have before us Order 230207-10, Vice Chair Krieger.
Chair, I'll move approval of the order 23020710 in the matter of extending a sole source determination of St. Vincent de Paul for navigation services at safe sleep sites and delegating authority to the county administrator to execute a contract amendment for these services.
Moved by Vice Chair Krieger and seconded by Commissioner Senaga. We have Order 230207-10 with Commissioner Buck in recusal. Discussion to the motion. I see none. I'll call for the vote. All those in favor, please say aye.
Aye.
Any opposed? None opposed. Passes 4-0 with the Commissioner Buck recused. And as we wait just a moment for Commissioner Buck to rejoin us, we'll look at the next item on our agenda. We'll be recessing the Board of Commissioners. At the sound of the gavel, the Board of County Commissioners will enter into recess, and we will be convened as a joint meeting of the Board of Health and Board of County Commissioners. We are convened. And first item on the agenda is item 1A, which is a report on suicide prevention in Lane County, 2000 to 2020, updated trends, risk factors, and recommendations. And today we have Ms. Mokraiska. I'll ask you to introduce your panel. I'd introduce you myself, but I welcome, and I see Ms. Gray is not at the dais, so Ms. Mokraiska.
Thank you, Chair. Yes, so Eve Gray, our Director of Health and Human Services, is here along with Jocelyn Warren, our Public Health Manager, and Roger Brubaker, our Senior Community Health Analyst. They're going to walk you through a presentation on our suicide prevention work in Lane County over the last couple decades. So I'll turn it over to Jocelyn.
Chair Farr and Vice Chair Trieger and Commissioners, thank you for having us. This Board of Health report actually represents the first of our quarterly reports, so that's a new schedule that we've moved to, and we certainly appreciate the opportunity to come before the board quarterly. Our first presentation by Roger Brubaker represents an update to another presentation that he did is that 5 years ago, Roger? So we look forward to that. And then we also have an additional presentation. So we have a bit of an extended amount of time this time because we also have a very exciting report to present, a 10-year anniversary report. So that will follow Roger's report. But I will turn it over to Roger. Thank you.
Thank you. Get this set up. I could have the PowerPoint come up. Oh, sorry. Yes, good morning, Commissioners. Again, my name is, for those of you who have not had the opportunity to meet yet, my name is Roger Brubaker. I work as the Suicide Prevention Coordinator in the Prevention Section at Lane County Public Health. I'll be presenting information today related to a report that we've just published today titled Suicide in Lane County, 2000 to 2020, Updated Trends, Risk Factors, and Recommendations. This report is the second epidemiological analysis of suicide mortality in Lane County, published by Public Health. The last time that we presented on these data to the Board of Health was in 2018. Before I get into the findings and the recommendations for the Board of Health today, I just want to take a moment to pause. I will be discussing the topic of suicide abstractly at the population level. However, I want to acknowledge the pain of this topic individually. I encourage folks to take care of themselves while I discuss this topic, and I particularly want to highlight the use of 988, the National Suicide Prevention Lifeline, for people in distress. The goals of my presentation today are to provide a brief overview of the suicide prevention program at Lane County Public Health, for those of you who may not be familiar with what we do. Also to provide an update on the American Rescue Plan Act funds that were allocated by the Board of Health for youth suicide prevention following an increase in youth suicides in 2022. And also share the findings of this report itself, Suicide in Lane County. Just to provide a brief overview, like I mentioned, of our programs, we look at our work broken up into three primary categories. These are prevention, intervention, and what we call postvention. Postvention is a unique term used in the suicide prevention world that means the strategies that are used after a death by suicide to limit the spread of suicide in communities and also to respond to the bereavement needs of people who are impacted. Just a brief review of what we do in these three places. Number one, in prevention, we do real-time surveillance of suicide trends. This means looking at who is dying by suicide, who is attempting suicide, and who is seriously thinking about suicide in our communities, much like this report will share. We also focus on upstream prevention through the work, through our collaboration with the Suicide Prevention Coalition of Lane County. This is an independent group that has worked with public health for nearly 2 decades now in various forms. It's evolved over time, including people with lived experience of suicide and professionals from multiple sectors working on suicide prevention, bringing them together to work on the community conditions that can make our community safer from suicide. Around the topic of intervention, we offer trainings directly to a variety of different community partners and technical consultation on some of the behavioral healthcare system issues related to suicide prevention. Around postvention, we collaborate with a variety of different schools and youth-serving organizations in accordance with Senate Bill 561, which is the piece of legislation that was passed roughly about 6 years ago, requiring every local mental health authority in the state of Oregon to have a coordinated postvention response plan after the death of youth and adolescents. That's people who are 24 years of age and younger. Like I said, I also just want to provide a brief update on the ARPA funds and how we've used them to date. We had 3 primary strategies for the use of those funds. Number one, our budgets are frequently, we are all grant funded, and our budgets are frequently tight. And the ARPA funds have been particularly useful to let off some of the burden of those budgets. And we use them primarily in this way to purchase a number of the training materials that we use when we do suicide intervention skills training. So these are just things like brochures and the costs of doing these trainings. We have purchased all of those items, and these trainings are ongoing. We also purchased, we're also in the process of purchasing a variety of what we call lethal means restriction equipment. This is the phrase that we use just to describe the variety of items such as firearms lock boxes or cable locks, trigger locks, medication lock boxes, and sharps lock boxes. And we have been distributing them throughout the community previously, and we will be using the ARPA funds to purchase even more to support home safety. Also, there is an unfortunate trend in many schools throughout the nation, Oregon, and here in Lane County as well. We share this trend where there is not a lot of direct student engagement around education and training about suicide prevention. This happens for a number of reasons, and that I can go into if you wish during questions and comments. However, we identified this problem and said that at Public Health, we wanted to do something about this to support the education of youth in our high schools and middle schools. So we are in collaboration with a variety of rural school districts primarily that we have strong ties with, developing a brief curricula lesson and set of lesson plans to ensure that there is evidence-based education around the topic of suicide prevention for youth directly. The most likely person that a young person is to tell about their distress or suicidal ideation or their serious thoughts of suicide is a peer. And we really want to make sure that they have the skills to support one another and to connect ultimately with trusted adults. Okay, so I'll start showing you a couple of the elements of this report, and I will encourage you, I know that the full report was included in your packets, and I'll encourage you to look at the full report in detail, as it is highly detailed, and I think will answer many of your questions. And again, I'm happy to do so here in this space as well. So I just want to share with you this first graph of suicide trends in our county. So what you're looking at here is the suicide rate in Lane County compared to the Oregon and US state rates. You'll see up there, if you're not familiar with this language, that these are age-adjusted rates, just simply meaning that in different populations, there are different distributions of people amongst age groups, and so we standardize the way that the numbers are run on this so that we can compare between different populations. Lane County is particularly older than a lot of other counties. We have more older folks, and that really can skew the numbers when we look at trends around suicide, as I'll share actually in the next slide as well. So between 2000 and 2020, we know that 1,458 people died by suicide in our county. The rate of suicide, if you look at this blue line here, that's our Lane County rate. The rate of suicide increased by 80% during this time. As you can also see, it has been consistently greater than the national average and also relatively consistently greater than the state average as well. In 2020, for example, the suicide rate in Lane County was 65% greater than the US average and a little bit over 20% greater than the state average. So as I mentioned, age really matters when it comes to suicide. What you're looking at here is the rates of suicide in different age categories in Lane County between males and females. I'll make a quick note here. The data systems that we have available around suicide only identify biological sex. They do not identify gender, and that is unfortunately common for all of these data systems around the suicide mortality data that we have access to. And this is actually an issue that's being addressed at the CDC level, but will take some time for it to benefit analysis such as this. What I just want to remark on this, and I think it's relatively clear if we look at our red line representing males, green representing the total average over the lifespan, and the blue line representing females, is that as people age, suicide generally tends to increase. However, this is very different for males and females. If you see the red line there, you can see that it only increases and actually starts what we would say exponentially increasing amongst our older adult populations. That's where we see our greatest risk of death by suicide. However, among females, we tend to see a decrease of risk after middle age. These trends are entirely consistent with state and national trends in the in the U.S. We also had the opportunity to look at where people die by suicide in our community. And what we were able to identify through our analyses were that people in the communities of Florence, Junction City, and Cottage Grove all roughly had about a rate of suicide about twice as much as the county average. This is consistent with the findings that we identified about 5 years ago in a similar analysis. And we know this to be, again, consistent with national and state data on suicide trends in rural communities. So aside from sex, age, and geography, we also know quite a bit about other characteristics of suicide decedents in Lane County. Sorry, when I say decedents, I mean people that have died by suicide. So roughly 1 in 4 was a veteran or military service member at the time of their death. We do have a significantly high population of veterans in our community, and they are deeply impacted by suicide. And again, this is what we know on the national level is that veterans traditionally have roughly about a 2 to 3 times greater risk of suicide death compared to the general population. This is a finding that I always want to take a moment to pause on and really emphasize when we look at mental illness amongst people who die by suicide. Mental illness is usually seen as a strong or primary driver of suicide, and it is related to suicide. However, the data does not support an overemphasis on mental illness purely as a primary driver of suicide. The lifetime prevalence of mental illness in the general population is roughly about 1 out of every 2 people at some point in their life will experience some sort of mental health problem. Amongst people who die by suicide, that's roughly about the same. About 50% of people who die by suicide had some sort of mental illness or mental health problem. So we often focus on mental illness as a driver of suicide and look at how the behavioral health care system should be the primary support of people in distress over the question of suicide. However, I would argue strongly that a much more holistic public health approach is going to be a more effective way to approach the question of suicide. I also share this because I think it's important. We have a tendency in our society to stigmatize people who think about suicide, who die by suicide, and we have a tendency to distance ourselves from them as well, especially around the topic of mental illness, as if this is irrational or unexplainable or not even understandable. And again, I would really, when I look at these data, to me, it demonstrates that people who die by suicide share a lot of characteristics with the general population. And when I think about suicide that way, it helps me understand that people who are at risk of suicide are much like myself, much like these people, and like everyone in this room, frankly. Mental illness does drive suicide, but it's because the experiences associated with mental illness are painful. And pain is if we are to identify a primary driver of suicide, it is pain. And pain occurs in a lot of different ways. I also want to emphasize the role that firearms specifically play around suicide. Over 50% of people who died by suicide in Lane County over the past 20 years died through the use of a firearm. About 3/4 of these people died through the use of a handgun. They usually died in their own homes as well. We don't know the true prevalence of firearm ownership in Lane County. However, state data from the RAND Corporation demonstrates that roughly about 50% of households in our state contain at least one firearm. We know that also that survival rates from firearm suicides are extraordinarily low, as you can imagine, as you can understand the lethality of a firearm compared to other means of death. So I always take this moment when discussing the ways that people die around suicide and firearms particularly, to take a moment just to emphasize the importance of safe storage. Meaning that when firearms are not in use, they should be stored locked up. And this is actually in accordance with Oregon Senate Bill 554. I would actually then argue that we should go beyond that, like many other states have argued as well. Now, state preemption disallows our county from making any case for this. However, at the state level, this could be made, that firearms not only be stored, not only be locked up when not in use, but be stored unloaded with the ammunition kept separately. Lethal means restriction matters because delay matters. The impulse to die by suicide is oftentimes quite brief. People may think about suicide for long periods of time, even a lifetime, but the impulse to act on those thoughts is oftentimes, sometimes no more than 5, 10 minutes, maybe a half hour. The pain is still felt, but the impulse to act is no longer present. And whenever we create delay, we create safety. We also know the substance use history of many people who died by suicide in our community. Roughly about 1 out of every 3 people who died by suicide had some type of substance use problem in their lifetime, whether that was a long-term misuse or disorder, addiction, or intoxication at the time of their death. And the number one culprit, if you will, is alcohol. It is not some sort of exotic street drug or anything like that. It is alcohol, the most common, legal, accessible, and prevalent substance in our communities. We also had the opportunity to look at where people work or where they did work before their death by suicide. We know that roughly about 85% of people who die by suicide in our community were in the workforce at the time of their death. And the largest industries or occupations that they participated in were the construction and extraction trades. So extraction in this context is quarrying, mining, which is a common industry in our community. Production and transportation and material moving also showed up as common industries or occupations amongst people who died by suicide in our community. We note this because so much of our healthcare system is intertwined with where people work and also with the conditions in which they work. We know that the construction and the construction trade, particularly at the national level, has recognized, and at the state level, has recognized the prevalence of suicide in their industry. And has a number of different resources and strategies to help construction workers as well. So beyond some of the characteristics I've discussed already, we also know that disparities and inequities influence suicide as well. I use these two terms separately. Disparities are differences between populations, it just means difference. Inequities are differences that result from oppression. Suicide rates among different subpopulations demonstrate the real complexity of this, actually, in a unique way when we look at suicide as a health outcome compared to many other health outcomes. So number one, I'll just identify. I've already talked about males, and in this context, I'll expand that beyond sex and look at gender as well, men. In our societies, men experience very rigid cultural norms that highlight and prioritize strength, individualism, oftentimes a lack of emotional development or awareness, the acceptability of risk-taking and substance use, and primarily also when it comes to suicide, because suicide is a form of self-directed violence, the acceptability of violence. And this is really important when we think about who acts on suicidal thoughts and who has the capability to do so. All of these rigid cultural norms limit the ways that men can be masculine. This leads many to feel that they don't measure up and to perceive their failings severely. This leads men towards greater suicide rates, particularly among white men. In social justice work, we often say that oppression harms both the oppressor and the oppressed. When it comes to suicide data, I think that these data specifically are a prime example of the harm of oppression on the oppressor. I also want to highlight the experiences of unhoused populations among people who die by suicide. Roughly 1 out of every 20 people who died by suicide in our community was either homeless or experiencing housing instability or eviction at the time of their death. People who cannot participate in their economy or society cannot access the social determinants of health. Suicide is yet another example of this trend. So there is some data that we cannot analyze. Like I mentioned earlier, we don't have data systems that allow us to look at gender. Similarly, at the local level, we don't have the ability to look at race or ethnicity around suicide trends or sexual identity and gender identity. However, I don't want to allow those limitations to influence the recommendations and findings of this report and what I communicate around it. In any given year, indigenous populations and white populations have the highest rates of suicide in the US. I will emphasize the importance of understanding suicide among indigenous populations specifically because amongst all racial and ethnic populations, they are the only population that, if you remember that curve that I showed you about when people age, that their suicide risk increases, indigenous populations are the only population in the United States for which that curve is completely inverse. Youth have the greatest rate of suicide amongst those groups, and it actually decreases as those populations age. And this is completely unique amongst any racial or ethnic population again. The other group that I would want to highlight would be LGBTQ plus youth and adults. There is emerging research that demonstrates the prevalence of suicide amongst these communities, plural. And this, again, I would emphasize as continued evidence of marginalization and exclusion. So I have, I again encourage everyone to please take the opportunity to read the full findings of this report and the recommendations that we have included for a variety of different sectors in our community. However, I have pulled out a few select recommendations that I think are more salient to the Board of Health. Beyond the personal tragedy of suicide, suicide is evidence that our social ideals frequently go unrealized and are regularly endangered, that we live in a disharmonious society. Suicide is always about people. It's not just about the person who dies. It is about all of us. This fact is really hard to accept in a society like ours, where bootstrap narratives emphasizing the power of an individual to solve their own problems continue to hold sway. Alternative narratives of social cohesion and support are too frequently drowned out. This results in a society that often stigmatizes people in distress rather than accepts an appropriate portion of social responsibility for their lives. Stigma and taboo block out the voices of people with thoughts of suicide who might say, "For me, this world didn't work. You may be okay, but I'm not. I need help." I want to stress as I take a look at these recommendations, again, emphasizing the public health nature of them, you'll notice quite, I think, clearly that there is not a list of specific behavioral health care systems recommendations here. That suicide, we can generalize about suicide, and there will always be individual circumstances that don't fit those generalizations. But when I am willing to make those generalizations, I will say suicide occurs because people feel disconnected, they don't have strong relationships, they don't feel that their life matters, that they have purpose in this world, and that they see this as a permanent state of affairs, that they have lost hope. Now, when I think about those themes and those feelings can emerge for a variety of different reasons. Suicide is multi-causal. It is incredibly complex. And again, I'm rarely willing to recognize one stronger driver than another. It is many, many, many things. So the question, these questions about how and why people die by suicide, like I said, are complex, but these are questions over which you as government officials have influence. The social policies you pursue become the reality for people who live in Lane County. The following recommendations I feel are germane to the ways that inequity are manifest in our community and over which the Board of Health has influence. And again, I will state, please note that these are really not healthcare systems recommendations. So the recommendations that I would have are to continue to support the work of the Community Health Improvement Plan to promote the health of all people in Lane County, to continue to prioritize the policy work associated with the development of accessible and safe housing for all Lane County residents, to continue to support the efforts to mitigate climate change and prepare for the impacts of climate change among people in Lane County. The Oregon Health Authority, underneath each recommendation, I have a hyperlink to a evidence-based resource that I would encourage the Board of Health to take a look at. I will note this one in particular, that the Oregon Health Authority recently produced a report called Climate Change and Youth Mental Health. And to summarize, it's a large document, but to summarize its findings and why climate change is so important around I wouldn't just say the mental health, but the feelings of safety and purpose that people have living in this world, are that we oftentimes, let's take anxiety, for example. We oftentimes think about anxiety and people will frequently kind of think about how anxious thoughts are not necessarily connected to always a future reality. Climate change is a future reality. There is an anxiety around it because the world is warming, because this is happening, because the future will not be the same as the present. And when youth are understanding this and experiencing this, this is a real threat that they experience. I would even argue similar to the threat of war, and that this is impacting the ways that they feel safe in our communities and ultimately impacting the ways that they can relate to one another and trust the adults in their lives and the things that they tell them. The final recommendation that I would share with you is to continue to promote a culture of equity, inclusion, and safety for all people in Lane County. I would again point to the findings of the Lane County 2020 Health Equity Report, which can be found on the public health website. And again, just to emphasize the importance of this recommendation, if suicide is about connectedness, safety, and hope, people who are marginalized and oppressed do not have access to those things all the time and are influenced by our society. And as a result, may consider suicide, or at the very least experiencing great deals of distress and feeling that their lives don't matter as much as others. I just want to take a last moment here to thank you. And I just want to reiterate my encouragement for people in attendance today and listening online to connect with people and things that make them feel cared for and loved, and also to highlight the use of the National Suicide Prevention Lifeline at 988. And I'm happy to take questions from the Board of Health at this time.
Thank you, Ms. Brubaker. And Dr. Warren, anything to add before we go to the board for questions?
No, please go ahead.
Thank you very much. Then I'll look to the board for a queue for questions, comments regarding excellent presentation, Mr. Brubaker. You know, I've been following your work for it seems like a long time now. And in the early days, we were looking at very specific, almost rudimentary efforts that were taking place, particularly at the school level. And I think in no small part because of your work, we've seen some true increases in awareness and programs at the middle school and high school level. So I've witnessed you working in Bethel schools, for instance, so thank you for that. To the board, Commissioner Buck.
Thank you, Chair. It's a lot to take in, because that's people who work in your department. That's a lot to deal with every single day. And I know that you and your team save lives in Lane County. I thank you tremendously for all that you do. You had noted in the graphs that Lane County is far exceeding national averages. And so my question really is why? Why Lane County? What is it about what's happening here versus the rest of the state. We know that we're somewhat unique being a medium-sized county. But at the same time, there's got to be certain circumstances that are, festering here locally, and I'd love to understand that more.
Yeah, if you don't mind. That's a really hard question to answer, and one that I get frequently, unfortunately, and I have not, over the 5 years in this position, developed an adequate response, unfortunately. But there are a few things that I can point to. I have, in this presentation, I've de-emphasized actually, and I don't want to undersell though. I've de-emphasized the way that we talk about suicide in regards to the behavioral healthcare system. However, the behavioral healthcare system plays an enormous role in suicide prevention nonetheless, and it should. We have very few psychiatric providers in Lane County. So just in terms of our healthcare system readiness, we are underprepared in that way. There is as the commissioners know already, I imagine, there is a behavioral healthcare workforce shortage in the state of Oregon at the moment. There is a lot of work going on at the state level to improve that state of affairs, but it is currently still underfunded and understaffed. I would also say partly that when we look at these data, overall that we share trends in common with the Pacific Northwest, and sorry, just with the Northwest in general. So Washington, Idaho, Wyoming, and Utah all share higher rates of suicide than the nation as a whole. Our ranking changes every year, but I believe this year we had the 11th or 10th highest rate of suicide in the state of Oregon compared to the national average. And there is not a body of research however, there's not a body of research that tells us why Lane County is different and what is occurring here. We could argue that part of this, and I don't want to frame this as casting blame or anything, but we could frame this like in some ways as a matter of demographics. Like I mentioned earlier, Lane County is skews older than many other communities. We do have a higher veterans population than other communities, but I don't think that those answers are adequate in many ways. And so, unfortunately, I can point to some influences, but I cannot answer that there is a strong primary kind of condition in Lane County that leads to these higher rates of suicide.
Thank you. Thank you, Commissioner Buck. Commissioner Lovall.
Yeah, thank you, Chair. Mr. Brubaker, thank you for your work. I have been a personal recipient of your personal phone call when my son died, so I want to thank you in public for that. You run a great team, and you were very responsive and very helpful in my time of need. So I want to tell you congratulations on a team that you run well. I have a few questions on the presentation, just because my mind kind of bounces off specifics. When you had mentioned how many lethal means items that we have, how many have we distributed thus far? Do you have any idea?
Oh, how many, the medication lock boxes and the firearms lock boxes? Yeah. So far we have distributed, sorry, my math is going to be a little fuzzy on this, but I believe somewhere in the range of about 2,500 lock boxes. And these are a variety of things, rifle cases, handgun lock boxes, medication lock boxes. And we are planning to order roughly about another 4,000 items.
And then that funding will run out and we'll be scrambling to find funding for that later. Is that what I'm hearing?
Correct, yeah. So the ARPA funding is temporary, obviously, and there is no other funding stream that would allow us to purchase those items in the quantities, I think, that would be necessary to have significant impact.
Right. You also mentioned too that, obviously the question is why is Lane County higher? And you were kind of going in that track, which I was tracking with you very well about, we have more veterans here. Obviously our population's more white. We have older people. So all those statistics line up with, older white men committing suicide. And I'm just kind of wondering, we have some specifics that you'd mentioned for youth services, but I'm wondering if there's anything specifically that we have in the pipeline coming forward for, I don't know, men my age that are white and older and, empty nesters and all that. Is there anything that we're doing as a county to rally those troops around consciousness of suicide?
Well, I guess I would say this around the consciousness of suicide, then this is where I always highlight the use or the importance of the Suicide Prevention Coalition of Lane County. Like I shared for decades, it has been an organization that has raised awareness of suicide and trained people to, and currently now its primary initiative is to train people to participate in crisis interventions as well. The other things that I could highlight as well are I know that there's a lot of ongoing work around the Crisis and Stabilization Center in the county, and I think that will be an enormous benefit. Additionally, sorry, I'm blanking all of a sudden. But additionally, at the state level at least, for the first time, a lot of suicide prevention work is directed primarily towards youth. That is the kind of just the historical trend. At the state level at least, there is a policy option package that's being considered right now to develop greater adult suicide prevention initiatives. And I was part of the work group that helped establish and frame some of that work and emphasizing the importance of looking at our highest risk populations, being older adult males, and specifically the reasons and circumstances around why they die by suicide so much at such greater levels than others.
I think as a culture, we're weaponizing white men a little too much. Maybe we should back off a little. Wouldn't you agree?
I guess I would need you to clarify what you mean.
Well, I mean, as what the people that I've experienced have been over there, have been at that age, have committed suicide. They've made mention before they leave that they feel like the white man's being weaponized now more than ever. So I would agree with your statement about maybe you made a statement earlier that said white men oppression is somewhat of an indicator. So I would just like to just say, is that still an indicator in your mind?
Oh, no, I need to clarify that then if that's been misunderstood. I do not feel that white men are oppressed. I do feel that white men frequently, this is a generalization, frequently represent the oppressor. And when we talk about oppression and marginalization in our society, frequently in social justice work, like I said, we talk about how when oppression occurs, both the oppressor and the oppressed as populations are harmed. Suicide for me is an unfortunate example of how the oppressor is harmed. I do not feel that the privilege that white males experience in this society is oppression. I feel it is privilege. I feel it is, and I feel that privilege specifically leaves men feeling that they have very limited options in their lives, that their success is fundamental to their identity. And in that case, when they fail, they perceive those failures severely in ways that, because they don't man up, they don't measure up to those high ideals. And as a result, it leaves them in a very precarious position. So I would actually argue very strongly in the opposite, I believe, of what you're suggesting.
Interesting. One more question, if you don't mind. You said that we were looking at the drivers of suicide based on jobs, and in your data, that data slide, there was 218, 15.8% of suicides were not in the workforce. So I guess the question is, when you have your tenants here at the end about we need to make sure that we have housing and that kind of thing, my experience was, in the suicides that I've personally been involved with, my family included, has been that isolation has been one of the key factors that contributes to suicide. So in that statistic, it looks like to me like those people not in the workforce, those tend to be more isolated, are the ones with the highest percentage of suicides. Would you not agree with that?
Sorry.
Based on your slide, 15.8%.
Oh, let's go back. Let me just make sure I understand. Sorry, could you please clarify?
Down here, it says not in your workforce, homemaker, unable to work, inmate, et cetera. 218 suicides, 15.8%, which is more than, almost double the other 3 items you had mentioned beforehand. So, I'm just wondering if isolation is something that we're missing the boat on.
Oh, I understand. Yeah, gotcha. Yes, absolutely. As I mentioned, those themes that are caused by many things, of disconnection and lack of a sense of purpose or meaning in one's life, sometimes for many people are attached to their employment. And so, yes, I could understand why a person who is unemployed or cannot participate in the workforce, particularly in a society such as ours that really attaches so much value and personal value towards with somebody's employment status, that those who do not participate in the workforce could feel that way. Absolutely, yes.
All right, good. Thank you. Thank you, Chair.
Thank you, Commissioner. Commissioner Seneca, followed by Vice Chair.
I did just have a quick, and Commissioner Buck hit on it a little bit too. I couldn't help but notice Junction City, Cottage Grove, and Florence were highlighted. So in my head, I'm just going through scenarios of what that might be. I mean, can you help with that before I say what my scenarios are?
Yeah, no, absolutely. Yeah. So what we know, generally speaking, right, when we look at the research around suicide, is that rural populations tend to have higher suicide rates than metropolitan populations, right? And I think we can, the easy answer around that is that metropolitan populations frequently have greater proximity or access to the healthcare system, and that people living in rural populations do not have that same level of access, right? So that's probably certainly one influence. But then also, again, there's a lot of generalizations here, I think, and because when we talk about suicide, we must talk about culture. It makes this hard. So please give me a little latitude when I talk about these cultural generalizations. Is that people living in rural communities tend to also have different cultures, right? I mean, we have identities around rural cultures, and they frequently rely on greater senses of individualism. Rugged individualism is a term that's used quite frequently, right? And maybe a sense that I can solve my own problems. And that is a really important characteristic for many people, and it has real world importance, right? And like I was sharing with Commissioner Laval around some of the cultural attitudes and norms around men specifically, some of those strengths at times, in times of crisis, can become weaknesses, right? And they can leave people in very precarious positions. So those are the two things that I could comment on, and there's a variety more, but those are the two that come to mind immediately.
I was just looking at it from a school board standpoint, and I know Junction City and Florence both have a pretty good counselor to student ratio. So I was kind of wondering if it's something that gets forgotten as they get out of school, or maybe that's not being addressed at the school level, or what could be fixed between the two.
Oh, gotcha. Well, I guess one of the things I would like to highlight, no, I understand. No, one of the things I would like to highlight is that we currently in Lane County have what's called a Garrett Lee Smith Youth Suicide Prevention Grant. We have agreements with 11 rural school districts where we are helping, where over the course of 4 years, we have been helping them support the implementation of what's called ADDIES Act. This is Senate Bill 52. This is the piece of legislation that required for the first time in the state of Oregon that each school district have a suicide prevention, intervention, and postvention plan. So we have been working with them over the course of about 3 years now. We have 1 year left in this grant to support youth suicide prevention efforts in those communities.
Thank you, Commissioner. I'll go to Vice Chair Trigger, and we're about 15 minutes over on this item, but don't slow down. Vice Chair.
Thank you, Chair. Thank you so much for your work and your excellent presentation. It's so much appreciated. I wanted to just flag, because it's a very dense report, so embedded in it, particularly for new commissioners who might not have been here when it rolled out, and we all got the link, the Why We Build project video series, I think is a really important example of people in the community modeling those you wouldn't expect that of to struggle in that way, sharing their stories. So I just highly recommend watching that video. I had a couple of quick questions about with the lethal means restriction, the lock boxes, and so on. Do we coordinate with Sheriff's Office? It's my understanding they in the past have received some of those items. How do we ensure when somebody comes for a CHL, for example, that they're offered or given a lockbox? What do we do to integrate across our departments in that way to get those things out to community?
Gotcha. Sorry, could you clarify CHL?
Oh, sorry, concealed handgun license.
Gotcha. Yeah, so no, our current efforts have not been in coordination with the sheriff's office. They have historically had their own independent distribution efforts. Our efforts, currently at least, have been primarily focused with schools, making sure that, because we just see them as such great dissemination points for youth and families to create greater home safety. But yeah, they are not tied up in the sheriff's office work. And I'll say this, and I think that I can't speak for the sheriff, but I would say this as well, is that we actually, that's important. We actually want to distance ourselves from law enforcement around the topic of suicide prevention, to create separation there, simply because people at risk of suicide should not have to interact actually with law enforcement for any reason necessarily, and so we want to make sure that they are able to receive these items in the most discreet or comfortable way that they can. So we've been providing them to school buildings in the community, and so currently every single school building in Lane County has been stocked with many of these items, and in the future, with our future distribution efforts, we plan on providing them to a variety of other behavioral health care providers and social service agencies throughout the community.
Thank you. That approach makes sense, and I understand why you would do it. I guess I'm thinking more as a preventative, seatbelts in cars. Why not everyone who gets permitted gets a lockbox? So thank you for that. And then the last question I have, particularly because of the sort of contagion factor among youth, I know we've recently launched the TIP program, the Trauma Intervention Program, is that what it stands for? How or if is your work intersecting with the TIP program obviously they're responding in the case of suicide, among other traumatic events, but how might data be collected or referrals come back to your department or your division and your work with the implementation of that program?
Yeah, thank you. That's a good question. So we've been strong advocates of the TIP program for many, many years within our efforts. So we still need to work out the mechanics of everything because they are still staffing up or getting all their volunteers sorted out. But I've been in contact with their director, Bridget, about making sure that when we're trying to adopt a similar set of strategies that are used in Clackamas County, which is where probably our most proximate TIP example is, where they have agreements, their medical examiner's unit, the TIP program, and the person who holds my parallel position in Clackamas County work together in the aftermath of deaths by suicide, so that when the medical examiner and law enforcement show up on scene, that TIP can provide care for the people who are impacted and communicate and share information with our programs to ensure that we have not only timely communication, but that we have comprehensive communication, that all people who are impacted by a particular death get the services that they need. So a lot of this needs to be worked out since it's a new program, but we have been working with them from the minute they got started.
Terrific. Thank you so much, and just thanks again generally for your work. Appreciate it.
Yeah, absolutely. And if I just may take a moment, just because you mentioned it, about the Why We Build project, that is a project that also came out of our offices in cooperation with the Suicide Prevention Coalition of Lane County. And we really see it as a pairing with a report like this. We can tell stories about the data, and they're abstract, and they're cold, and they're important. And we can tell stories about the humans that are impacted by suicide. And at whywebuild.org, that's where people can learn more about those stories of people right here in Lane County.
Thank you, Commissioners. I have a couple of questions, nothing beyond what has already been explored by Commissioners. A number of years ago, actually, when I first met you, was following Chloe Wilson at Willamette High School, a 14-year-old who took her own life. And I became closely involved with the parents at that time. And you, at that time, were reaching out to the high schools. At that point in time, it was reported to be a spike in teen suicides in local area high schools. Can you talk about that? Where is the trending on teen suicides? What's happened over the last 6 years?
Yeah, so Lane County has identified what we, two clusters of youth suicides. These have both been abnormal increases in the number of youth and adolescent suicides in a particular period of time, right? And that's, I don't have all the numbers memorized, unfortunately, about what that looks like at the moment. But yes, the previous one was in 2018, I believe, and our most recent one, which I reported on previously, was over a much more protracted period of time in 2022. Currently, it appears that we have not had, that we are not experiencing such an increased frequency of youth suicide deaths in our county, but I would still really recommend that we remain incredibly vigilant around youth suicide.
And thank you for that. And once again, I thank you at the very start of this, but thank you again for the efforts. I was personally involved when you were at Willamette High School, and we had large groups of people come in following Chloe's suicide. And you paid a great deal of attention. I believe my instinct, and I think the data supports it, is you made a difference. Thank you very much, Mr. Brubaker. And thank you, Dr. Warren, for today's presentation. Anything else for this item? Your slides are available to us. If I didn't find them online, are they there? Great.
Yes, they are in the
Roll all the way through the
Perfect.
report.
All the way through
After the report.
long report. Thank you very much. Thank you.
Thank you, Chair. I am going to turn it over to Jacqueline Moreno, who is here to deliver the 10-year report. This will be extremely positive. This is a very unique program. It's unique in Oregon, and I think it may be unique in the country. It's a prevention program, so it's primary prevention, often in collaboration with schools or other community partners, funded through our coordinated care organizations in Lane County, of which we have two. But I will let Jacqueline talk a little bit more about that, and she also has some co-presenters that she will be introducing. Excuse me.
Thank you and welcome, Ms. Moreno. And before we get started, I'll mention to the board that we are on item, let's see, it's item, where are we? Which item are we on?
1B at the Board of Health.
1B, the Board of Health. Which, thank you, Ms. Moreno. And Ms. Moreno, you're a senior community health analyst, and you've worked with Lane County for what, 5 years now?
Just about.
Thank you very much. And I'm going to take a second to introduce a couple of panel members who I'm very, very familiar with. Shar Revis, Chair Shar Revis, I call you Chair Shar, and Tara Devi. I've known both of you for a lot of years. Tara, you a lot more years than
31 years.
anybody else in this room, quite frankly. We go back a long, long ways.
We do.
And Tara, two of the founding, Shar and Tara, two of the founding members of the Community Advisory Council, about 10 years service in the role, I think, each of you. It seems like every time I turn around, you're there. And I think Katie Hatteras is, Caitlin, are you with us online right now? We'll keep an eye out for that to see if Katie was scheduled to join us today. So I'll turn it directly to you. I'm used to turning things over to Chair Shar. So Ms. Marina, I'll turn it over to you.
Thank you, Chair Farr, Vice Chair Trieger, and Commissioners. As Chair Farr mentioned, my name is Jacqueline Moreno. I am a Senior Community Health Analyst in the Prevention Section of Lane County Public Health. And today I have the honor and the joy of co-presenting with two of my friends and our community members who represent our Community Advisory Council, Tara Devi and Shar Revis. As Chair Farr mentioned, they have both served in this role for over 10 years. And they, along with the rest of our Community Advisory Council members and Prevention Work Group members, have just spent countless hours dedicating their time to this work and working with our public health staff and our local healthcare administrators in improving the health of Lane County. So I just want to thank you both while we're in this space, on the record. So today, oh, I have slides. Let me see here. Thank you.
I'll go ahead and share, Jocelyn.
Sure. That was very mysterious. Okay. Thank you, Ms. Jones. So today we are going to be sharing some of our successes from this visionary partnership that we have between public health and our local coordinated care organizations, or CCOs. In Lane County, our CCOs are Trillium Community Health Plan and Pacific Source Community Solutions, whose governing body in Lane County is the Lane Community Health Council. In Lane County, we are very fortunate to have CCOs that understand the importance of primary prevention and public health, not just that they are delivering quality healthcare, but also that they're ensuring that we have an ongoing investment in this health promotion and prevention in primary prevention programs in the county. So before I share about some of those health promotion programs that we are offering, I want to give a little bit of background on the Community Advisory Council and this CCO Public Health Partnership itself. Oh, and I don't have control. Can we advance the slides? Thank you, and you can go one more, please. Thank you. So the Community Advisory Council is a requirement of CCOs mandated by the Oregon Health Authority, which requires that all CCOs have a governing body made up of at least 51% Oregon Health Plan or OHP consumer members. And this Community Advisory Council is responsible for advocating for accessibility and equity in healthcare, for making decisions about CCO community investment spending, and for overseeing the community health assessment and community health improvement plan processes. I also want to mention that the Lane County Community Advisory Council, I think, is really quite a model council in our state. We have folks from the state level and also other counties who I think look to us in a lot of ways because we have such robust member engagement. I mean, look at who is co-presenting with me today. It's amazing. We have a number of subcommittees, which are outlined on this slide. We have great member retention, and I want to give kudos to someone else who is here in the room, Kayla Watford, who is our Community Advisory Council coordinator. But yeah, we have a model advisory group. And what I'm going to be talking about more specifically today, though, is one of these subcommittees here. So if you advance to the next slide, there's a little highlight showing the prevention work group specifically. So as you can see, the prevention work group is a subcommittee of our overall Community Advisory Council, and it is charged with overseeing our prevention funding and portfolio. The funding of the portfolio and the prevention strategies is a really innovative and effective funding model. This is all due in thanks to our extraordinary leadership from Lane County Health and Human Services leadership about 10 years ago when we entered a contractual agreement with, at the time, the only CCO was Trillium, but we entered an agreement with our CCOs to establish an ongoing sustaining funding set aside. And this set aside is really an investment in those primary preventions. It funds the programs and services that I'll be mentioning today, as well as our public health team that helps to administer the programs and the staff who also convene our advisory groups. It's also important to note that, as it is demonstrated on this slide here, that the prevention work is informed by our Community Health Improvement Plan, in which the primary goal is establishing community conditions that promote physical and mental well-being. And the Community Health Improvement Plan is really an all-hands-on-deck roadmap that our governments, healthcare system, schools, local nonprofits, that all of us can use as a roadmap together to have collective impact and to measure the impacts on health in our community. If we could advance the slides, that would be wonderful. Thank you. So on this slide, I will be talking about some of our priorities and the approach of the programs themselves. So for the past 10 years, the Council's health promotion and prevention work has focused on providing creative upstream prevention programming in the following topics, which are outlined here on the side. We have tobacco use prevention and cessation. We have empowering kids to be healthy, which is kind of a catch-all for our school-based programs, many of which have to do with nutrition and physical activity for young people. We also have a bucket for mental health promotion, which does include some suicide prevention programming. And then our newest priority or bucket here is our sexually transmitted infection prevention priority, which is kind of our newest emerging need in Lane County that we are currently conducting a needs assessment about. So we don't have any strategies implemented yet, but they are coming down the pike. And then on the right of this slide, we have more about the actual delivery or implementation of the strategies. You can see that the bottom of this pyramid of approaches here, we have changing the context. And this is all about creating environments in which people have healthy choices to make. The next level is going to be our long-lasting protective interventions. So these are going to be, programs you might think of like in a classroom that are going to be evidence-based curriculum or programs in which we know that when students are exposed to those programs, that we can change risk factors or improve protective factors over time as a result of their exposure or participation in these programs. Many of these school-based long-lasting protective interventions have robust return on investment data, indicating ratios from about $13 to $15 saved for every $1 invested in this prevention program. And then the top part of the pyramid here is our counseling and education programs. So these are strategies that are going to be a little bit more intensive or more tailored for certain folks who are self-selecting or being referred in. And maybe they're not necessarily impacting everyone at the community at that time, but they're being offered to everyone at the community. And these have a smaller and a more targeted reach, but the return on investment can be as much as $80 to $150 per dollar invested. So now that I have shared a little bit of background on our Community Advisory Council and the partnership and kind of what this work approach is, I'm going to share about some of the successes and the actual programs. So if we advance the slide, I can talk about the first one before I pass it off here. The first priority I'll be talking about is empowering kids to be healthy, and in particular about the CATCH program. CATCH is our most widely implemented program and is really the foundational program in this priority of empowering kids to be healthy. CATCH stands for the Coordinated Approach to Child Health, and it is not your typical health curriculum, but rather it is a blueprint for improving the health environment of a school. Since 2015, public health has helped CATCH be implemented in 22 elementary schools in 11 of our 16 school districts. It's an evidence-based program that has over 30 years of research showing improvements in healthy eating habits and physical activity minutes, as well as classroom behavior management and attendance and academic performance and all kinds of good stuff. In 2023, we are really excited to be launching more into the early childhood CATCH program, and we will be starting with some rural communities in South Lane County with a particular interest in recruiting Spanish-speaking childcare providers who will be trained in the program and be implementing that. I also want to call attention to the pictures on the slide here. We have the board outside Bonita Elementary School promoting their CATCH Day they had. We have a scene from inside the gym at Danabo Elementary in the Bethel School District where they invited families to come in and learn about the CATCH program. And then the bottom left picture is of our partners at the Head Start of Lane County program who are becoming trainers in that early childhood CATCH program. And so for our next few program highlights, I'm going to invite our Community Advisory Council member, Tara, to share. And we can also advance the slides here. Thank you.
Thank you, Jacqueline. Good morning, Commissioner Farr, or Chair Farr, excuse me, Vice Chair Traeger, and the rest of the commissioners. It says to introduce myself, so I'll try to keep this brief. My name's Tara DeBee, and I'm one of the co-chairs of the Community Advisory Council along with Shar Rebus. We work together and have worked together for a long time. And I volunteer in other parts of the community. I volunteer at Lane Transit. I also work in the court system as a citizen review board member. I've done that 18 years, I think. So I've kind of have a well-rounded volunteer, I don't know what you want to call it. It's what I do, and I'm not unique in that. There's lots of our Community Advisory Council members volunteer in other parts of our county, and I think that's what makes us unique here, because we can bring in all our different experiences, personal and just some of the work we've done, and I think that really helps us to be a well-rounded Community Advisory Council for sure. We can always make improvements in making sure that we cover all the different categories. We tend to still be, and I'm just going to say it, a very white board or advisory council. We do have, I mean, it's not just all white people, but I think we can work on that. And anyways, so that's a little bit about me and the work we do. And this isn't just about me or Shar. We're talking for a lot of the council members today. So our next success story we want to share is about our Sources of Strength, which is one of our many mental health promotion programs. Sources of Strength is a radically strength-based, peer-led suicide prevention program. Since 2021, prevention staff have facilitated sources of strength training for over 20 staff. And the staff included included teachers and administrators. Currently, 20 Lane County schools from 7 districts are implementing this program, and an additional 7 schools plan to begin implementation in this next school year. So Sources of Strength is the first program to show effectiveness in using peer leaders to increase protective factors associated with reducing suicide across a school population. It improves adult-youth relationships, increases help seeking, and studies suggest that the distressed youth may benefit from this program. And I'll hand it back to Jacqueline.
Yeah, I just wanted to add too that Sources of Strength is just one of the health promotion and suicide prevention programs that is funded by our CCO work, but that we do work closely with Roger Brubaker and his team of suicide prevention specialists. And since suicide prevention is such a complex issue, I feel like we are very fortunate to have multiple modalities and funding streams to implement these programs in schools, including not just the CCO work, but also the American Rescue Plan Act funds that the commissioners have allocated towards that school-based work. So just wanted to acknowledge that.
Okay, and as you can see on the slide, we have the Sources of Strength wheel and a photo of the North Eugene High School peer leaders. In addition to school-based mental health promotion programs, our prevention portfolio includes strategies that support parenting education, including the family checkup and positive parenting program known as Triple P. And as a side note, I signed up for that just to check it out, but I'll be honest, I haven't tried it yet. My kids are grown, but that doesn't mean I can't learn some great skills. So I'm excited to actually start working on that. Mental health outcomes.
Yeah, can we advance the slide,
Yeah.
please?
Advance the slide.
Thank you.
Speaking of programs supporting parents and families, one community level outcome worth noting is that the rate of depression diagnosis among 18 to 34-year-olds above the federal poverty level has almost doubled since 2010 to 2013. However, this dramatic increase is not seen in the same age group or at below the federal poverty level. It is possible that some of the increase seen in this group could be due to increased access to care in our Medicaid expansion into 2014, including an increase in health promotion programs serving Medicaid recipients. It's always nice when we have a little bit of good news to share. And speaking of good news, I'm really excited about this program, probably because I was at the start, we worked on this program, and it was called Q-TIP, not to be confused with TIP. So I love the acronym Quit Tobacco and Pregnancy. And the Quit Tobacco and Pregnancy is a research-based program that is tailored to best fit Lane County. When the
Could we
program,
advance the slide, Tara?
oh, yeah, I think there might be a slide.
Yeah,
Sorry.
thank you. Sorry.
Pardon
I'm
my
not even
interruption.
focusing on the slides. Thank you. When the program first started, we tried out the program in the OBGYN offices. But after the first year, we realized we were not getting as much buy-in to the program, and we had to come back to the table. And instead of just scrapping it, what I liked about it is we were willing to just really take it apart and figure out, we know this is a good program, at least we like to think it is, right? So, and we put a lot of work into it. And so we decided, why don't we put it in our WIC program, Women, Infant, and Children, and we can capture the data there. And it has been so much more successful. And we're so pleased that we can show that sometimes our ideas may not always work, and that does happen. But sometimes we can come back to the table and just refigure something, and then it works way better. So I'm very proud of this program myself. I'm just glad that we're seeing definite decreases in smoking. It's not just smoking, that's why we call it tobacco smoking, anything to do with tobacco. Anyways, I'm just personally very proud of that. And
I want to say something.
yes, please do.
Yes. I just want to really commend Tara on this program because she worked so hard, even when it fell apart and it wasn't working. I mean, this, in my opinion, is your program, and
Oh.
you did an amazing job with your team.
Oh, thank you, Shar. I appreciate that. Thank you. Pregnant people can either be referred by their provider or they can self-refer, which I think is really cool when people can do that. You know, it kind of empowers you to be able to do that. Participants receive cessation, coaching, resources, and incentives for participating and for quitting. The Q-TIP program has been recognized as a top practice for Medicaid administrators in Oregon by the Centers for Medicaid and Medicare. We're very excited about that. So ideas are they get diaper bags, they get, I believe we still do gift certificates or gift cards. Now, there are limits on there. You can't buy tobacco, firearms, that kind of stuff. But hey, maybe you need some food for your family, right? Or some new clothes. And it's amazing what something like that can do. They find that there's a dollar limit where it does work and where the research finds that it doesn't work. Is it around $500? Do you remember?
I think it's two.
Or maybe it's more.
Yeah, so the participants can earn up to $150.
Okay.
For participating.
For participating.
Sorry, for quitting smoking while they're.
Yes, yes, and then the value of other gifts with it. So it's pretty cool what, and I think that's a big part of why it's working personally, but that's just me thinking that. And for the next slide. There we go. Program data from 2015 to 2020 demonstrates a decrease in Lane County OHP members who report smoking in the third trimester. This is not observed in the total Oregon population. Programs like Q-TIP help to diminish healthcare costs associated with premature birth, low birth weight, and other impacts of pre- and postnatal tobacco use. And I'll finish that up by saying it also is helping the family members in the household, right? And the pets. Now, we haven't researched all that, but those are the things that we talk about also. So it's really a bigger bang for our buck. So thank you, and back to Jacqueline.
Thank you, Tara. We are going to shift gears now and talk about a culminating report that recognizes the first 10 years of this work. So Commissioners, I hope that you received a copy of the report in your board packet, but it is also available online, and other folks can also request a print copy through the webpage that is shared on the slides here. But I'm going to pass it over to Shar to share more about the report.
So, yeah, there it is. Okay. I was going to say advanced slide. Thank you, Ms. Jones. Okay, so my name is Shar, as everyone knows, and I work, I'm also, as Tara said, co-chair to the CAC. I also am on the board for the Lane Health Council, and I had another thing I'm on. Oh, yeah, Rural Advisory Committee that used to be a council, and been on that since the beginning of it. Because I'm from Florence, and I mean, it was just an amazing move they made to do the Rural Advisory Council, because there was just a different type of issues that were in the rural Lane County than in the metro area. And I think that we've done a lot of work on that in trying to bring all that together for services. And a lot of times there aren't enough in the rural areas. So that's where I kind of started with this part. And so we're so excited. We're just so excited to share this report with you and the community at large. It celebrates the first 10 years of Community Advisory Council, the Public Health CCO partnership, and our prevention portfolio. And this report draws from 10 years of program data, partnerships, milestones, publications, and presentations, and interviews with council members and community representatives. So as Jacqueline said, we've also published an interactive timeline of events, which include accomplishments and milestones from this first 10 years. And advance slide?
Yeah, can we advance the slide?
Yeah, okay.
I was just going to call attention here. So this URL here, preventionlane.org/CAC10, is the webpage where folks can access the report as well as these supplemental materials, including that interactive timeline. And I think we can advance the slide one more time.
I like that slide.
I was going to mention.
and yeah, let's-
There may have been a few familiar people in there.
And what were you guys, was that a
Okay, so we
Reedsport?
were in Reedsport. Trillium had, at the time, there was a bunch of money that was given to Project Blessings and their food program in Reedsport. And so they invited us to come, and we, every time, it's really hard to talk about it without getting tearful, but we got to serve food boxes for holidays to myriads of people that just kept coming through the door, and we would ask them if they wanted turkey or ham, and then we would pack them a box, and they got to kind of choose what they wanted to do. And it was an amazing, amazing day, and the people that came in were so grateful. They were just so grateful and gracious and excited that they were going to have this extra amount of food for them. So that picture that you saw was pictures of us posing afterwards. So, of course, this work would not be possible without our many community partners. And as you see there, I'm not reading all those because, yeah, look at how many people got involved in this prevention work. And really, really grateful to all of them because it took us all to really do this program in a way that would benefit our community, both in the metro and rural areas. Public health reaches the community through a network of partnerships in K-12 and higher education, healthcare, behavioral health, youth and families serving organizations and nonprofits. Not only are these organizations vital to delivering the programs, but many of them help the Community Advisory Council to stay informed about emergent needs. And that is a big aspect of this, coming to us and making reports, allowing us to ask questions and, be able to give feedback on what's working, what's not working with the program. And it's just valuable to do this work, and it's a team. We're a team. We all work together for the greater good of our community and making sure that these programs are successful, these prevention programs. Yeah, slide 14, right?
Sure, yeah, let's advance the slide. Thank you.
So finally, we just want to thank our fellow Community Advisory Council members. I don't think we have anybody. It'd be a nice time to see if Katie's on. Caitlin Hatteras.
Katie, are you with us? I'll drop her a quick message and see if she...
Okay, because she also came in real early on and did tremendous amounts of work on the Community Advisory Council. And also, I think she was on another, what was the steering committee or CHIP stuff? CHIP stuff, in the very beginning. So anyway, we also want to note that this report is it's dedicated to the memory of a few council members who, this is hard for me, who have passed on over the years, but I said I'd take it on. So this report is a celebration of their contributions that have made such a difference in this community. And I just want to stop and take a moment to reflect on how important the people up here are to this Community Advisory Council and to the success of it and to why it is what it is today. Without the people on that board, on that slide, we would not be the same as we are right now. Because they worked hard. David Parker, a lot of you may know him. He was on several different committees. He was our first chair of the Community Advisory Council. Great guy, funny. Man, he did so much work. He did so much work for our community on our council, on prevention in other parts of our subcommittees.
He was chair of the Community Health Council for
Yes,
many, many years.
Chair of the Community Health Council. Yeah, it's just amazing person, very missed. L.M. Reese, I did not know him well, although he come up and told me, you live in a rural area, you need to work on transportation. That was my first, yes.
He was big with
He was
LTD.
big with LTD, he was big with transportation, he was big with ADA access and transportation. And
I think back then we called him the vice chair. I don't think we had co-chairs back then.
you're right, yeah, he was the vice chair.
And he
with
served
Amy.
on our board also.
Yeah,
At Trillium, yeah.
amazing guy. And when he retired, he asked me, you know, to keep carrying on about the rural transportation issues, and he just worked on it tirelessly. So then there's Susanna Samus. Susanna was a great person because she would come in and totally in public and say, you got to deal with mental health. And she was very open about her struggles with that. And funny, oh, she was funny, but man, she held you to it when it come to making sure that we discussed what was important and tried to find more opportunities and less barriers for people with behavioral health issues. She was amazing.
She worked at NAMI, or she volunteered with NAMI
Yes.
several places, yeah.
Yes, I'm
Yeah.
glad you're coming in
Yeah.
because I know you know.
It's hard to
something
remember.
Right? And then there was Cindy Williams. We lost Cindy Williams not too long ago. I don't know how many of you may have been at the MLK groundbreaking when we drove the tractor and or whatever that thing was, scooper. Anyway, she gave the most profound speech about her life and struggles with addiction and behavioral health issues. And she came on before me. She was so nervous, and I'm like, Cindy, you're gonna do fine. You just speak your heart. Just speak. And oh my God, she was so nervous. And she got up there and she just nailed it. And that room was so packed you could barely move. There were so many people in there. That was just it was such an amazing speech. And she did great. And and then there was Marianne Malott, yes.
And she worked on the homeless prevention board,
She
is that
did.
correct, Pat?
Yeah.
And she had hearing problems, and man,
Yes.
she made sure that she had everything she needed in the CAC meetings.
Yes.
So that she could hear, and if she couldn't,
She would let you know.
she'd pound on the table and say, hey, I can't hear, I can't participate if I can't hear, right?
Yes.
So fix it, and we would, and you know, they would get the technology. But she was lovely, a great advocate. So I just want to make sure that we never forget any of the people up there because they made a difference in our community and they were in the beginning, you know, and I'll never stop thinking about them. I'm not gonna cry, okay? So,
Me neither.
yeah, I know, right? Because I know that you guys knew some of them too. So I guess how I would like to end my little portion is to really talk about what it means when you change things. So once it's done, you can't go back anymore because it's done. So you've changed it for the better. Why would you want to go back when it was something different? So always look to it that way when you're thinking about it. What we've done to change how we deal with healthcare, how we deal with prevention, working with our youth, and looking back from our older adults, I hate being in that category, but I am, and seeing where things went wrong and what we can offer to our generations underneath our children and their children's children, because I think why this is so important. We picked everything apart, we broke it open, we made a difference in how we do things, and now we just keep going and we keep fixing things, and by the time our children and their children get into the positions that we're in advocating, they'll be looking at healthcare in a whole new way and in a way of prevention. So I'm going to end with that, is that we're making a better future for our kids and their kids. And I know that our youth and the next generations are going to come in and do major things, because it all started here. Thanks.
Thank you, Chair Shar.
And I just want to kind of wrap up before we take comments and questions and just share that, as you can see, prevention and even public health in general there's a lot of talk about programs and evidence-based programs. But when I think about the Community Advisory Council and the prevention work, it's really about people. And so I just want to again thank my co-presenters here and sharing their experiences and their years of experience and expertise on this. So thanks again. And thank you, commissioners, for your time.
Thank you. Wonderful presentation. I was okay till you got to Mary Ann.
I know, right? Loved her.
So we have time for questions or comments from the commissioners. I'll just say one thing. The CAC and the RAC are regular items of conversation around my dinner table at home. And it's always good news. It's always the accomplishments and the people that you reach, the lives that you touch through your work, but then also through your absolute outreach. You talk about the distribution in Reedsport. And that day you described, I've heard that description before, and is remarkable. The people who otherwise, as we know, would have been very pressed for nutrition during that particular period of time, during the holidays. So back to the board. Any further comments? Commissioner.
Real quick. Charlo, I look forward to our future meeting in Florence. I really do. What a great group over there. I say it all the time. Florence is an amazing community. I mean, they always show up. Their events are just amazing. So I look forward to that. I'm glad you're on the board, and I think it's the first time a presentation was wrapping up that I was going to applaud. Thank you, guys. Great job.
Thank you. Commissioner Lovell, followed by Commissioner Buck.
Yeah, thank you, Chair. I'm just kind of one of those people where I'm a noticer of people. My past career as a photographer makes me look at faces. And Jacqueline, look on your face. You are so proud of these young women, Tara and Shar. You have such a fan club with her. And the two of you are just like giddy little sisters. And I just love the passion and the love that you have. And, I'm just thinking about when you started this and about how many times that you've run up against roadblocks and how many times that voice in your head saying, this may not be worth it. Maybe I should go be a master gardener or something else. And, I just want to applaud you for sticking with it for so long and knowing that the mental and the health of our community is so important to you. And that's a legacy that I just want to acknowledge publicly and just tell you thank you from the bottom of my heart that you guys are doing the work you're doing, because there's so many people that complain about it, but not many people step up and do the work. So good on all of you. Thank you very much. Thank you, Chair.
Thank you, Commissioner Buck.
Thank you. Chair Revis, this is like a whole new side of you that I didn't know about. I can't not say Chair Revis, she's, the chair of the Homes for Good board. And so you are in everything, and I didn't even know you were on this side of things as well. And I appreciate both of you being willing to spend so much time on a variety of very interrelated but disparate committees. I always want to honor our volunteers because you could be doing anything else with your time, and you've committed such a large amount of your time to things that from experience are really able to change lives, especially we know with their youth. So I thank you very much for doing that. And I'm happy to see the progress over the last 10 years, even though I wasn't there when you started long before me, committing to public service. And so I just deeply appreciate that. And your model to others in your community is just, it's a high threshold. And I wish more people in the community knew what people like you are doing.
Thank you. Vice Chair?
Thank you, Chair. All of that, and just personally, Tara, it's so good to see you again. I haven't seen you
It's so
for
good to see you.
yeah. I just want to appreciate these two women for their fierce advocacy and their strength as leaders in the community. We need more women like you, and I'm so happy that we had a chance to highlight and show everyone and anyone who might be watching this today and in the future just what strong leaders and how you lead with such strength and compassion and focus, and appreciate it very much. Thank you both.
Thank you, Vice Chair. And, you know, there's not enough time or words to talk about the work that you all do. And Katie, who's not with us, but Katie is also, she's currently on the Community Health Council and the CAC, and the list goes on. The amount of service that you put in, it's unbelievable. Every time I turn around, I think back at the table, the very first TAC presentation, do you remember that? We were all in round tables over what's now Eugene City Hall, I think. And we were all at the same table, and Marianne was there. And I loved the way she was able to address crowds because she talked with above average clarity and volume.
Very true.
And, you know, I just sat in the shadow of, well, anyway, that was an example of the times that you all come together and just 1 + 1 = way more than 2, and you're all together. So thanks very much. It's once again, there's not enough I can say. And we do talk about the CAC. We talk about the work that you do and the deep outreach and deep into the community. So thank you very much. Sorry. Then anything further, Ms. Moreno?
No, that's all.
And Director Gray, you're with us. That's all right. Thank you for being here. And Dr. Warren?
Thank you, Chair. I want to note too that the Community Health Improvement Plan has come up in both of these presentations, and we will be bringing more about that to our next Board of Health report. So we're very excited for that and have talked with this group about coming back before another 10 years have passed, hopefully. So we're looking forward to maybe doing more regular updates from this group. They're doing really important work in our community. And I also want to appreciate Elizabeth Maxwell, who is the supervisor for the prevention program, for whom overseeing both of these, both Rogers Suicide Prevention Program and the CCO Prevention Program as well. Thank you very much.
Thank you, Dr. Warren. Dr. Maxwell, good to see you. Then it looks like we've come to the end of this presentation. Thanks very much. Anything else you'd like to add? I wish you could stay here. You want to stay through lunch break? We've got that coming up.
We should just add this.
Thank you.
Thank you.
And even a standing ovation for the work you do. Thank you very much.
Thank you.
Well, I'm going to look to the board for our next choice. We can go into the lunch break a little bit early, or we can attempt to address the executive committee meeting, the executive session.
Chair, we need to adjourn the Board of Health meeting.
Oh, we do need to do that. I'll adjourn the Board of Health meeting and reconvene the Board of County Commissioners. And with that, do you want to go into executive session before lunch break, or shall we hold that after the end of the day?
I wouldn't mind doing it now, if
Okay.
that's okay with everybody else. I don't know how long it's intended to be, though, but I'm fine with getting it done earlier.
Okay. I think it was up to 20 minutes. And I've heard that staff is prepared to be with us. Ms. Jones, can you confirm that we could step into executive session in 5 minutes?
I will let the staff know right now.
Thank you very much. Then we will move into executive session. Now, at the sound of my gavel, we'll be recessing the Board of County Commissioners, and we'll reconvene in executive session in our offices at, let's try it at 12 minutes till. 12 minutes till the hour. The Board of County Commissioners will meet in executive session to conduct deliberations with persons designated by the governing body to carry on labor negotiations. This executive session is held pursuant to ORS 192.6602D, which allows the Board of County Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on any of the deliberations during the executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session. We reserve the right to come back out into public session should the need arise. We'll reconvene in executive session at 12 minutes till noon.